Health for November 10th, 2021. And this special meeting was meant to be somewhat coincidental with the rollout of the COVID-19 vaccine for children and 5 to 11, and also to discuss and pass a resolution with regards to vaccine. And so our first item of business here is a board member roll call. So if you could, this will also work as a comms check for us. Commissioner Cami Bremer.
Here.
Okay, we're gonna have to have really good discipline about the mute button, because if there are people other than board members who are dialed in, they'll need to wait their turn until we get to the public comment section. So make sure that you're on mute unless you're a board member. So Commissioner Cami Bremer.
Present.
Councilmember Dave Donaldson.
Here.
Councilmember Sam Geek.
Here.
Kari Kilroy.
Here.
Doris Ralston.
I'm here.
Here.
Hi, Dr. Richard Vu.
I'm here.
And Ted Colas, Fire Chief Ted Colas.
I'm here.
And I'm here. So we have our full, oh wait, Commissioner Gonzalez, are you there?
I'm right here, thanks.
Oh, great, okay. All right, well, let's go ahead and begin. The first action item is approval of the agenda. I think we've all received a copy of the agenda electronically several days ago. So I would entertain a motion to approve the agenda.
So moved. This is Doris.
Okay, Doris. And second?
Second by Ted Colas.
Thank you. All in favor?
Aye.
Any opposed?
Aye.
Okay. So I have here's how I would like to conduct the meeting today, is that first of all, since it's a virtual meeting, we're going to need to be real conscious of giving all the board members an opportunity to lean in, and I'm going to do it in a kind of a circular fashion. I'll have a pattern, and I'll go around the room at least twice. And the purpose of the meeting today is, as I mentioned, to pass a resolution regarding COVID-19 vaccines. But it's important to state right up front that this is not a rebuke or refutation of the Board of County Commissioners resolution, which was recently passed, and that was about mandates. So I want to draw a clear, bright line early on in the meeting that we're not going to be talking about mandates. This is not mandates. There's not a mandate in the resolution. So just to clear that up. I'm going to give everybody an opportunity, obviously, to make comments, and we'll do it twice. We'll do it early on in the space we normally reserve for board member comments, and then we'll do it again when we bring up the resolution. And I'll bring up the resolution. I'll read it into the record as it is currently amended, and then we'll go around the room again. So that's what I'd like to do, and then there will. I'll read it into the record as it is. This may not work if people who are not board members don't mute their computer. Okay, so then we will move after that into the public comment section, and I'm told that there are over 200 members of the public who would like to comment today. That's fine, but let me kind of establish some ground rules, and then we'll do it again when it comes time. Is that because of the large number of people wishing to make comments, we're going to need to limit it to 1 minute. And I've checked with legal counsel on this, who's also on the call, and that is allowed and appropriate. The other thing I would encourage members of the public to do from the very beginning is to listen closely. Listen closely to the discussion. Listen closely to the board member comments, and listen closely to the reading of the proposed resolution. I think that's going to turn out to be important. And then when we get to the public comments section, I've really been pleased in previous board meetings as to how polite and civil and disciplined and appropriate all of the comments have been, and would expect nothing less from this group as well. Let me just go ahead and lay it out there that personal attacks on board members or the board, or particularly our public health director or members of her staff, that'll not be tolerated. So 1 minute, everybody gets a chance, listen closely. And then I guess the last thing I'd like to say is that if you listen closely to the previous commenters and what you had to say is pretty much exactly the same, well then don't feel obligated. I don't think that hearing the same comments again and again are necessarily helpful. So with that, I have a few comments to make before we get into the meeting. And this is, again, the time that we typically set aside for board members to make comment. And you can comment on anything. Don't feel obligated to necessarily focus on the resolution, although that's the work of the day. So as I mentioned, this is a special meeting, hopefully coincidental, with a very successful rollout of the COVID vaccine for the 5 to 11 years old group. And I believe that Director Whelan is going to give us an update on that. We have some very good numbers to report back. This is a very complex environment that we have with COVID, with multiple different mitigation strategies out there, to include vaccination. But vaccines you might think of it as a toolkit. We have a lot of different tools in our kit, but vaccines turn out to be the very best one. And I think a lot of people would agree that vaccines are probably the most likely way that we'll end up on the other side of this COVID pandemic and end up in a situation probably like the annual flu. It's endemic as opposed to pandemic or epidemic, and that there will be an annual booster, and it'll become part of the background, part of the regular set of shots that we receive. I think that's what's going to happen. Some age groups benefit more from the vaccine, but all benefit some. And I think that it's important to also realize this interaction within the population, and that it's most helpful for seniors, but having children vaccinated helps the seniors too. It not only helps to prevent disease amongst the youngsters, but helps prevent serious disease amongst our unvaccinated seniors. So in the early days of planning for a pandemic, back in 2006 and again in 2009, when I was involved in in some of that. We have some ways coming up on the board meeting. When we were doing our early pandemic planning years ago, we knew that early on we would be at a disadvantage, and there were plans for many mitigation techniques, what we call a layered mitigation strategy, and what Commissioner Vanderwerf likes to call his family of interventions or family of mitigation. So those techniques were out there. We talked about them. It was something that was written into the plan, but we all knew that hopefully with the rapid development of a vaccine, that would be the key, that we would be able to relax a little bit, take a sigh, vaccinate the population, and then that would be our doorway out of the pandemic. What we didn't anticipate was a fairly strong public reaction against vaccination, and that has continued to impede our efforts. The Board of Health, in a discussion at our last meeting, said, well, why don't we come out strongly in favor of vaccine and make it timing-wise coincident with the 5 to 11 vaccine rollout. It turns out that it's more than that. There's the monoclonal antibodies, there's the upcoming oral COVID therapies, but today we're talking about the vaccine. So that seems like a good idea. And again, just to reiterate, this is not a rebuke of the Board of County Commissioners resolution and not a mandate that we're discussing today, but rather a full-throated support of the COVID-19 vaccine. So let's go ahead and continue with board member comments. And I'd like to start with County Commissioner Longinos Gonzalez, and then we'll go around the room and end up with Public Health Director Susan Whelan. Commissioner Gonzalez, comment?
Thank you, Dr. Turbush. So a couple of questions or comments, I guess, and I actually have recommendations on the draft proposal as well. But to start off with, I did see there was some information that had gone out earlier this morning or maybe last night, and I did want to address that. There was a concern that this meeting was in some way advocating for vaccination mandates. And so I want to reiterate again, I even had to go on the radio this morning and highlight the fact that that is not the case. That is not the case. And so everyone listening just maybe signed in just in the last minute and missed Dr. Turbush's earlier comments. This is not in any way a vaccine mandate resolution or request or discussion. That was never brought to me as an option. I will say if this had been that, I would be opposing that because, as was mentioned by Dr. Turbush, the commissioners have opposed that. We do not support federal and state mandates. But in this case, it's a resolution that in general comes down to supporting voluntary vaccinations amongst the public. And so in that case, it's much different than what I have been receiving hundreds of phone calls and emails on. So again, I just want to highlight that to start off with, and to maybe dispel that. One of my recommendations that can be discussed later is perhaps in the title, because a lot of times people just read a title and not understand maybe adding in support of voluntary vaccinations as part of the resolution. So that'll be one of my two recommendations.
Is now joining.
The other one, so that it's clear to the public. The other one is that even though I mean, clearly Dr. Turbush and others, there was no intention to have been some sort of pushback on what the county did last month on our separate resolution. However, based on all these hundreds of phone calls, two issues. One is the belief that it was perhaps a mandate, which it is not. The other one that perhaps there was some sort of tie to that in the past. And so My other recommendation is in the therefore paragraphs that perhaps the reference to the county and municipalities be deleted or amended in some way, because I do believe that may give a false impression of what the intent was from this. So to start off with, those are my initial comments. I might have a question on hospitalizations based on earlier conversations. I was on the vaccine update that I do monthly, and just wanted to start off with those comments for this meeting. Thank you.
Dr. Turbush, you're on mute.
Okay, let's go ahead and go to Councilmember Dave Donaldson.
Yeah, thank you, Dr. Turbush. Can you hear me clearly?
I do, yes. Thank you.
Thank you. You know, I have some questions. I don't know if you want to do it that way, where I ask some questions and maybe you could reply if you feel that's appropriate at this time, or you tell me how you
Why
want.
don't we, when we get into the nitty-gritty of the resolution, yeah, I think there'll be plenty of opportunity for that. At this point, I guess what I'm kind of engendering is an idea of any opening comments, thoughts about what the meeting is for today. You've had a chance to read the resolution. So general comments on your part, please,
Okay.
Councilmember.
And I did leave a voicemail for you last night. I don't know if you've had a chance to hear that yet. I had some concerns with the resolution. In fact, I can do this now, or I can do it later on. I'd like to make a motion to table the resolution until our next regularly scheduled meeting, so we have a little more time to go over exactly what's in the resolution, so I could be more comfortable supporting it, because right now I wouldn't be. And a big concern of mine is that one thing is 5 members of our board have no medical training. Two of us are physicians, yourself and Dr. Vu. I'm a PA, and Ted Colas is paramedic. But I don't know that the board has ever issued a statement in support of a specific medical treatment in such a, it's maybe not the best time to start doing that. So that'll be a question eventually. I do think this is an individual decision for an individual person or the parents of a child and their physician, and that needs to be the baseline, not one size fits all. Everybody needs to get a shot. I don't support that. So as far as opening statements, I think you can see where I am. And I'd like to listen to the other board members. I'd also like to hear all the input from the folks that want to speak today before we vote. Thank you.
Okay. Thank you, Councilmember Donaldson. The chair reserves the right to ask for a motion after we've had a chance for everybody to weigh in, and that'll be during the second part of our discussion after we read the proposed resolution. So we'll push that to a later time, and I will say words to the effect that I will entertain a motion at this point, and we'll have public comments.
Dr. Turbush, if I could, I'm sorry, if I could just finish what, I know I stopped, but could I say just a little bit more?
Please.
Okay. It was said already that the vaccines help all age groups, and I don't think that's clearly established for the youngest age groups, for children. I think the risk from the vaccine may be, or the risk of COVID is very, very low in that age group, and the risk of the vaccine may be almost equal to that. So the fact that we can immunize children and protect 80-year-olds, I don't know that that's a proper way to go about doing that. Thank you.
Thank you very much. Let's see, Councilmember Sam Geek.
Yes, sir. Dr. Turbush,
Sam?
thank you.
Go ahead, please.
I'm in agreement with Lejinos.
Okay, let's turn up your volume just a little bit, Sam, or get closer to the mic, please.
I'm in favor of what Commissioner Gonzalez brought up, and I agree that it's a recommendation, not a mandate. And the city of Fountain, we had my last council meeting was last night with the city of Fountain. So I'm not sure how far you want me to be involved in this, since I was term limited. This is my last meeting.
You're still on the board, Sam, so go for it.
Well, I just want to make sure that you understand that I'm my last one. So I
Well,
appreciate all the help that I've gotten and all the things that have happened for the city of Fountain with the county and the building down here and everything. I just want to make sure that everybody knows how much I appreciate the fact that the county has helped us a whole bunch down here in Fountain, and we really appreciate it.
Well, I think we appreciate the city of Fountain. And I think we'll hear a little bit more about that, some upcoming additional very exciting news about the South location. Well, thank you, Councilmember Geek. And let's see, Commissioner Cami Bremer, are you on the line?
I am. Thank you, Dr. Turbush. Good afternoon. I want to thank everyone who has taken the time out of their busy day to attend this meeting. And I really appreciate the interest that everyone has and how your government entities are functioning, how we're making decisions. And this is, I want to start by acknowledging that for the last 21 months, there has been a substantial amount of misinformation. And the longer we go on, the more emotionally charged it seems to become. And ultimately, it's caused incredible confusion. I think long-term substantial damage to how we work together in our society and our community. There are other forms of misinformation as well. And today, likely for political reasons, rumors were started that asserted that the local Board of Health is somehow imposing a mandate for vaccines. This is simply not true. Many of you are here for a meeting because you were misled or misinformed on this issue. Our board is not and will not be issuing a mandate for vaccines. There's not consensual support for it from the board. And I foresee no change in that direction on this board in the future. As we move forward, please continue to bring your concerns to your local, state, and federal elected officials, as you have a civic duty to do. But please also do your own research and before jumping to conclusions, because a Facebook post, email, or text is sent with inflammatory information. Doing so will help those of us on these your concerns on real issues and prevents the sort of misunderstanding and misinformation that clearly took place today before this meeting. To be clear, I am against vaccine mandates and have cast a unanimous vote with my fellow Board of County Commissioners declaring that. But we also have in our public health tool chest an effective tool against a public health pandemic. So today's resolution is one of supporting one of the most effective tools available to public health, vaccines. Encouraging people to gather information and consult their own healthcare providers on what is best for them and their families. And that's what I'm here to do today. Thank you.
Thank you, Commissioner Bremer. Okay, Corey Kilroy, please.
Thanks, Dr. Turbush. Sam, I'm sorry to see you go off the board. It's been a long time since I've actually seen you in person, but since now's the opportunity, I want to say I've enjoyed having you on the board, and I'm sorry to see you go. The second thing I'd like to say, Commissioner Gonzalez, I'd like to address your concern with that second bullet in the whereas. I can see how it would feel like that's like a direct sort of statement, I guess, at the county commissioner's proclamation, but I'll tell you, it wasn't. When I drafted this resolution to send to to send to Ted. He helped with it as well. And then to send on to Susan and her staff. I used a resolution from 2014 that I had also drafted back then. And that resolution was against the legalization of medical, or not medical, but recreational marijuana. And so I just did, save as, and the three therefores, that second one was there. I just amended the text to be applicable to the vaccination instead of marijuana. So I hope, I'm not going to die on that hill if that's really something you want taken out of the resolution. I don't think it lessens the point of it is that this is a tool for hopefully stopping and ending this pandemic. So if that needs to come out, I don't think it lessens what it says. And I really appreciate Commissioner Brenner, what you just said. I think you put it very clearly. I'll take Dr. Turbush's advice. I won't repeat what you said. I'll just ditto it. And I think this resolution for us as the Board of Health is important because we're really muddying the waters with politics and misinformation, like Commissioner Bremer said. This resolution is fact-based. It's based on science. It's not opinion. It's not someone's wish. It's the best way we know of this time in our history, in all of our unprecedented history of a pandemic, to slow this down. So those would be my opening comments. Thank you.
Thank you very much, Greg. Okay, Doris Ralston, please. We can hear you. Yes, go ahead.
I also appreciate what Kari said, and I can agree to amend the resolution with that. One of the things about public health is public health concerns people as a whole, and one of the foundational tools of public health is prevention. And I think that it behooves us as a Board of Health to look at this, especially when we have our rates of COVID climbing because of Delta variant and because of people not getting vaccinated. And I know there are breakthrough cases, but not probably as many as cases among those who have not been vaccinated. And I agree that it's individual choice and that we're not mandating that. I think it's a resolution that we could all support, I would hope, because I think it's, why have a Board of Health if we're not going to advocate for prevention and the health of our community? And that's such a simple thing to do. It's harmless. And they, as we all know, vaccinations are our best defense against COVID. So it's kind of like if we had something happen to our water supply system that was going to cause all of us to get sick, of course we'd want to, fix that. So this is, to me, not any different from any other public health crisis that could occur. And I think it's a harmless resolution. I would encourage my colleagues on the board to support it. I am not for tabling it. And I take exception to Councilman Donaldson kind of looking at the composite of the Board of Health. I'm not a healthcare provider, but I do have a public health background, and I don't think you have to be a provider to make good decisions on behalf of the public's health. So you just have to be interested, invested to do that. So those are kind of my comments, and I do think, again, prevention is foundational to public health, and I would support this resolution.
That's great, Doris. I'm gonna step in here just to kind of reinforce what you said, is that we have a great board. We have a tremendous Board of Health with a variety of backgrounds and skill sets, but in common, we have a love of our community and compassion for its members. And I think that's what you were getting to, Doris, is that we are the Board of Health. We're not the county commissioners and we're not the city council. We are the Board of Health. And that for us, each life is precious, and that compassion is one of our common characteristics as Board of Health. So I wanted to, in advance, thank each of you, and thanks, Doris, for your comment. Straight from his clinical practice, let's see, Dr. Rick Vu, would you be able to comment?
Yes, thank you. I just have 2 points. One is I think that I know that the COVID vaccine is safe, effective, and it saves lives. Therefore, a resolution to recommend the COVID vaccine and advocate for it. Point number 2 is as the Board of Health, in order to effectively protect the health of our community, I think it's important to also protect the cohesiveness and the unity of the Board of Health. Thank you.
Thank you, Dr. Vu. Very appropriate. Fire Chief Ted Colas, are you there, please?
Yes, I'm here, Dr. Turbush, and thank you very much. I think that Kari did just a wonderful job of putting together a prepared statement that captured many of the things that I was thinking. And then your comments following up on Doris were also exactly what I was thinking, that this resolution is really based on us having compassion for our community. We care about the people out there, and we want to advocate for what's in their best interest. And we're advocating that that people use the vaccine, use the tools available to them to keep themselves from getting sick and to keep others from getting sick. And this resolution is just that. It's a statement that the Board of Health is saying, use the tools available to you, keep from getting sick, keep from getting others sick. We care about you. And that's really my statement. It's not a political statement. It has nothing to do with anything that is politically motivated. It has to do with caring for our community and having people do the things that are in their best interest to keep from getting ill. Illness is one thing, but we know very well that this disease in certain parts of our community can result in fatalities. And we don't want to see another person succumb to this illness. And if vaccines can help us do that, almost everybody that I'm looking at on this page probably has a scar on your shoulder from a smallpox vaccine. And we were able to eradicate smallpox from being a disease that killed many people because people believed in and used the vaccine. And boy, I'd love to see the same thing to put COVID in our rearview mirror. So that's all I've got. Thank you.
Thank you, Fire Chief. See, it's awkward, but we're still getting a lot of feedback. So I would ask guests and board members perhaps to just turn on the mute when you're not speaking, and we'll see if we can hear. Okay, Director Susan Whelan, I believe that it's your turn, and you have something for us about the vaccines over the weekend, please.
Sure. Good afternoon, Board of Health, and everyone that is joining us. Wanted to refresh a little bit too, just on under my leadership and working with the Pikes Peak Office of Emergency Management, with as both city and county offices, that we have been focused steadily on building infrastructure and providing easy access to reduce barriers to prevention tools such as vaccines, but also treatments. And we're currently working on the monoclonal antibodies, which we're trying to increase supplies and gain more permanent sites for easy access. And then also when the Merck pill does come. So did want to mention that we received our first vaccine supplies in mid-December of 2020. And we advocate pretty heavily, not only with elected officials, but also with the mayor's office, to get our adequate supplies, because supplies were limited at that time. We have been successful in developing collaborations among the vaccine consortium, which is made up of numerous medical providers, for-profit, nonprofit pharmacies, to provide easy access for people to make informed decisions and for folks to get vaccines who choose to get vaccines. And so I think that we've been successful on that throughout El Paso County. We have the most populous county, and it's pretty vast. So we have locations throughout El Paso County to provide public health prevention tools, as well as working on to increase supplies of treatment as well. We have received emergency use authorization on October 29th from the FDA for emergency use authorization of the Pfizer BioNTech COVID-19 vaccine for the prevention of COVID-19 to include children ages 5 through 11 years of age. And we were poised and ready to offer the vaccine for parents of children that wanted to get vaccinated. And so we offered clinics alongside Children's Hospital and other medical providers over the weekend and in the evening on Friday, Saturday, and Sunday. And so we have provided hundreds of shots, and there's a data delay, but of what the actual numbers are, but it's over 1,800 vaccinations, and then in the 5 to 17-year-olds, it's over 28,000 doses within the pediatric populations. We have to date provided 883,700 doses of vaccine among our population, and we have 60% of our population which is fully vaccinated. I have asked our medical director, Dr. Michael DeStefano with Children's Hospital of the Southern Region, to say a few words, since it's very timely for the approval of the 5 to 11-year-olds vaccine, and we partner heavily with Children's Hospital. They are the experts on the pediatric population, and to just give us an overview of how things are going on the vaccine provider front. Dr. DeStefano?
Thank you, Susan and Board of Health, for the opportunity to speak today. As many of you know, Children's Hospital Colorado has been a strong partner throughout this pandemic, not just treating and healing children who come to us for their care, but also equipping officials and parents alike with information they need to make the best decisions for their kids, especially during this time. Today, I was invited to share information about the vaccine trials in kids 5 to 11, the recent approval of emergency use authorization for vaccines in kids in this age range, and why we, Children's Hospital Colorado, are excited to be entering this next phase as we vaccinate as many kids ages 5 to 11 as possible. Let me speak a little bit to the vaccine. So Children's Hospital Colorado was one of 81 clinical trial sites across the US, Spain, Finland, and Poland, and was the largest Pfizer site for the COVID vaccine trial for ages 5 to 11. The trial began at our Anschutz campus this summer, and parents of more than 5,000 Coloradans signed up to be considered for the study, which ultimately enrolled about 252 participants from Colorado. This was about 10%, a little bit over 10% of the global number of kids in the trial. One of our main goals at the hospital was to mirror the diverse population of our state's kids, and we're able to achieve that goal. We also had children with varying conditions, from asthma to cystic fibrosis to autism. I've watched this trial progress, and I am close to the doctors overseeing the trial and believe in the science and integrity of the trial and this vaccine. The team and the kids involved in this trial have done remarkable things, and I could not be more proud for their contributions. Fortunately, most children are not severely sickened by COVID, but children are impacted, especially with the Delta variant. I'm a pediatric ER doctor, along as with the chief medical officer here at Children's Hospital Colorado. And I've treated numerous children and families who've come into the emergency department with trouble breathing and other complications from the COVID infection. In fact, more than 2,000 children with COVID have been hospitalized in our hospital system, just within our hospital system, Children's Hospital Colorado, since the beginning of the pandemic. And while early in the pandemic, children and adolescents under 18 comprised less than 5% of the infections, now with the spread of the Delta variant in our communities, they comprise 25% of all infections. Those are kids are comprising 25% of all infections. Children aged 5 to 11 who are now eligible to be vaccinated actually account for almost 50% of the pediatric infections. Finally, I cannot emphasize more that because of the Delta variant is so contagious, it spreads in schools and children's and can bring COVID home and infect older family members. The vaccine was almost 91% effective in preventing COVID infections in children and was safe. There were no serious side effects seen in the vaccine recipients, and local and more generalized reactions were very similar to those in older adolescents. It is important for our community to know that hospitals across Colorado, including our hospital, Children's Hospital Colorado, are unusually busy right now. Since before school had started, we have been seeing high numbers of kids with respiratory illnesses caused not only by COVID, but other more common viruses like RSV, along with the surge in kids experiencing a mental health crisis. Influenza is right around the corner, which will put even more stress on our hospital systems. I urge everyone to get their child vaccinated for COVID, flu, and make sure your kids do not fall behind on the regularly scheduled vaccines like MMR, which prevents measles. Children's Hospital Colorado has been excited to partner with the state agencies to offer many opportunities for children and families to receive the vaccine. We're currently a host site for ongoing vaccine clinics run by the Colorado State Health Department, and we'll be working closely with local and state officials to make sure we're ready to vaccinate as many kids as possible ahead of the holiday season. As a dad, I know this has been a stressful time for all parents and caregivers who have had to keep up with the evolving health guidance and pandemic impacts on schools, social activities, and everyday life. For those parents who have questions or concerns, I encourage you to speak with your child's pediatrician or family doctor about the COVID vaccine. They can address your questions and help you make the best decision for your family. We also have multiple patient resources on safety and efficacy of vaccines, including frequently asked questions on our website at childrenscolorado.org that I'd encourage you to use as a resource. Children's Hospital Colorado is honored to play a part in helping deliver the COVID vaccine to our patient families and local communities. And we look forward to seeing many of you at our upcoming vaccine clinics. Thank you, and please stay healthy.
Thank you, Dr.
Yeah, you want to complete your report there, please?
And I appreciate the opportunity to speak, Dr. Terbush. I just want to emphasize that we are steadily making progress, especially from late last year, to build the infrastructure and offer free resources that are easily accessible to reduce barriers to help people access prevention tools and also treatment as they deem fit for themselves and their families. So thank you.
Thank you. I wanted to thank Dr. DiStefano as well. You know, we've been trying to get you here to a Board of Health meeting for some time and looked forward to hearing from you. And it's great that it has just worked out the timing when we could introduce the vaccination for the kiddos. So again, thank you, and you're always welcome here at the Board of Health. Thank you very much. Okay, well, let's get on to the business of the day. Let's see. Okay, I don't see any hands up right now. The business of the day is the resolution.
Dr. Terbush, my
Yeah.
hand is.
Oh, yes, Councilmember Donaldson. There you go. Go ahead.
Is Dr. Stefano still available to answer a question or two?
Yes, Dr. DiStefano. Looks like he's there.
Happy to answer a question.
Well, thanks, Doctor. I think some of us have heard about myocarditis in children with the COVID vaccine. Can you address that?
Yeah, I don't have the data in front of me to address strict numbers. It does happen in very rare cases, myocarditis. I'll tell you from my experience, I've seen more myocarditis secondary to MIS-C than I have secondary to the vaccine. And so as family members, as health providers, you always have to weigh risk benefit. And from what I have, the data in front of me, there are greater risks, I think, with having MIS-C or a COVID infection than is with the vaccine. But I think that's a good question. And one of the things that families should research as they are preparing for vaccination.
Can you tell me how many children, and first combine what is a child? Like when you say, I mean, you mentioned 25%, I think it was, of infections now are in this, or was it admissions? I couldn't quite follow you.
So that was children under the age of 18. 18 and younger is typically defined as a child. So 25% of infections.
And how many deaths have there been in America age group? Do you know? From COVID?
From COVID in America, I don't have that information in front of me. The mortality from COVID in pediatrics is less than, say, in the senior age group, but the morbidity, which is also important and we need to take into account, has not been insignificant.
Do you know what the mortality in Colorado has been?
I would have to take a guess, but it's not, the mortality has not been high in COVID for kids, but the morbidity has. So when I'm talking about morbidity, I'm talking about respiratory failure, being put on ventilators. I'm talking about myocarditis and heart failure. We've had to fly multiple kids out of Colorado Springs to our cardiac ICU, secondary to complications from COVID. So while kids have been resilient with this, it has been challenging from a care perspective, and it hasn't been as benign as what I think the general population has thought of it as.
And the COVID vaccine is approved on an emergency use authorization because of how dangerous it is, right? The high mortality rate it's causing, correct?
I am not familiar with how they define and why they define the emergency use. I think it has a couple of things to deal with, not just mortality, but it has to do with public health. It has to do with morbidity as well.
But, you know, my point would be that that's very true in older people, but in children, isn't it accurate that more children will die from flu than COVID?
I don't have those numbers in front of me. I think that is a question that I think people have. The numbers, absolute numbers, are different, right? And so when you take about, you have to think about this in prevalence. And so I don't have the comparisons. I can tell you that we typically don't see the complications of flu that we do see with COVID. That's what I do know from my experience in the emergency department.
Are there any long-term studies of COVID vaccine in children? You know, the safe COVID vaccine in children?
Obviously, this is a new vaccine, so no, there are no long-term data.
How long are vaccines normally studied before they're approved for use in children?
So I don't have that data in front of me. Obviously, this was rushed, right? This was expedited, but the safety profiles and the power of the studies were such that to try to get to some of the safety profiles to ensure safety for kids. But you're right, long-term data, we need to follow that. And that's like with every sort of vaccine we roll out. out, or any sort of thing that we roll out in medicine, that we continue to study it to ensure safety. If you're asking if I vaccinated my kids, I have vaccinated my children. So I have a 13-year-old, sorry, the age, 13, 12. And I also have a 10-year-old who unfortunately got COVID right before it rolled out. But she will be getting her COVID vaccine once she gets over her illness.
Okay.
Thank you.
Thank you. Thank you very much. And thank you again, Dr. DeStefano. Let me just run this out there. Do we have any other questions we don't get him here very often. It's a real opportunity. Any other board member questions for Dr. DeStefano while we've got him on the line?
Yes, this is Rick Vu. Can I ask a quick question for Dr. DeStefano? Dr. DeStefano, can I ask you, you may or may not know the exact numbers, but approximately how many children have been admitted to the hospital, to Children's Hospital here in Colorado Springs because of side effects of COVID vaccine?
I am aware of 0, but I don't have the data in front of me. As the chief medical officer, I usually get information like that. So I can't say with 100% certainty, but I am not aware of anyone that's been admitted to our hospital in Colorado Springs secondary to vaccine.
Thank you.
Any other board member questions for Dr. DeStefano? Going once, going twice? No? Okay. Well, let's get on to the business of today, which is to approve this resolution with regards to COVID-19 vaccines. Now, before I read it into the record, again, what I'm planning to do is to go around the horn after reading the resolution and specifically get, comments or questions from each of the board members. We'll be able to get a sense of the board from there. I think we have at least 3 options today. One is to, pass it outright with either unanimous or a majority. Second, to recommend a modification, and third, to reject the resolution. So those options are all on the table, and I would like to go ahead and begin with, well, here, let me read it into the record, and then we'll go ahead and go around the room. So these numbers that I have are of October 26th, but we've got an additional number since then, which we will certainly include in the final resolution. Maybe we'll be able to get some help as we go along. This is a resolution of the El Paso County Board of Health, whereas there have been 99,581 COVID-19 cases in El Paso County as of October 26, 2021. And whereas there have been over 5,000 hospitalizations and 1,080 deaths in El Paso County due to COVID-19 as of October 26, 2021. And whereas the Delta variant of COVID-19 is found to be 2.5 times as transmissible as the original virus, and whereas widespread vaccination is a critical tool to help stop the COVID-19 pandemic, and whereas the Centers for Disease Control and Prevention recommends everyone 12 years and older should get a COVID-19 vaccination to help protect against COVID-19, and whereas COVID-19 vaccination helps protect people from as the original. I'm sorry, please mute your computer. Let me start over. COVID-19 vaccine helps protect people from getting sick or developing severe symptoms as a result of contracting COVID-19 and might also help protect people around them. And whereas COVID-19 vaccines have been used under the most intensive safety monitoring in United States history, which includes studies in adolescents, and whereas COVID-19 vaccines were evaluated in tens of thousands of participants in clinical trials, the vaccines met the Food and Drug Administration, FDA, rigorous scientific standards for safety, effectiveness, and manufacturing quality needed to support approval or authorization of a vaccine. And whereas clinical trials for the COVID-19 vaccine include a more diverse group of subjects than previous trials for other drugs and vaccines, the population studied closely mirrored ethnic groups in the US population, and the trials also studied the vaccine's effect in people with certain chronic conditions, including diabetes and heart disease. And whereas COVID-19 vaccines are offered free of charge, Medicare, Medicaid, and private insurance will cover the cost of the COVID-19 vaccines. In addition, uninsured Coloradoans have access to free vaccines. Providers cannot turn away anyone because they cannot pay for the vaccine or don't have health insurance. And whereas colder weather means more time indoors where ventilation is poor, increasing the risk of spreading COVID-19, particularly among unvaccinated individuals. And whereas unvaccinated individuals make up approximately 85% of those hospitalized with COVID-19 in El Paso County, putting additional stress on the hospital system. Now, therefore, be it resolved by the El Paso County Board of Health that the Board of Health hereby finds that the best individual and community prevention measure to avoid serious illness, hospitalization, and death from COVID-19 is getting fully vaccinated against COVID-19, and that the Board of Health encourages the governing bodies of El Paso County and municipalities within El Paso County to advocate for and encourage El Paso County citizens to be vaccinated, and that the Board of Health authorizes each of its individual members and the public health director of El Paso County Public Health to advocate in support of the use of COVID-19 vaccines. So before we go any further, I think it would be good to go around the horn again and to try and get a sense from the board about where we're headed with this, and if you can support that resolution as is or with modifications.
Dr.
So-
Thomas, I apologize. Can I interrupt?
Okay.
To be
Dr. Wu, did you?
This is Rick Vu. You know, I apologize. The version of the resolution that I have might be a newer version than the one you just read.
And if you can support that resolution as is or with modifications.
Yes, can you hear us?
There's a lot of noise in the background, so please, everyone, mute your computers unless you're a board member speaking. Dr. Vu, go ahead again, please.
Yes, I apologize. I don't know if it's my mistake or not, my error or not, but the resolution that I have in front of me that was emailed to me this morning might be a newer version of the resolution that you just
Yeah, there's
read.
actually a room full of people, a health department.
Okay, Dr. Vu, I think I can answer your question. The version that I'm reading has not been updated with regards to COVID-19 cases as of October 26th and the hospitalizations and deaths in El Paso County. So what I would propose is that we could add that.
No, really, we were invited to speak and no one's having us.
Okay. Now, I started out this meeting with the idea that we're going to have public comment. There are over 200 people that would like to comment, and we're going to do it at the end. So please mute your computers. Dr. Vu, the numbers there have changed since October 26th, and we can make that change, please. Okay? Thank you. All right, let's start with Commissioner Gonzalez, please. Go ahead.
All right, thank you. Again, I had, in reference to the comments I had before, I do think it might be smart or is smart to include the voluntary in front of the support of voluntary vaccinations in the title, because I think that's what people are going to see in the newspaper. I still believe it makes sense because of the discussions and the perceptions out in the public. The removal of the city and municipality in El Paso County, therefore, which is the second bullet. And I had referenced it in previous emails and today's earlier vaccine discussions with Director Whelan and other local hospitals, not the first hospitalization numbers, but I believe it's the last whereas,
Mm-hmm.
where it talks about, COVID hospitalizations resulting in strained local hospital capacity. I keep getting mixed answers to my requests on hospitalizations. State dashboard says there's 16% of the hospitalizations or beds are for COVID. Locally, there was an article in the newspaper said 14%. I'm not sure which ones are accurate, but I asked several questions at the vaccine update meeting today. Dr. Vu was there, as was Director Whelan, and I did not receive the kind of answers I thought I would get, which was I didn't get an answer really. That I don't believe I got an answer. The other questions for 2 months, 2+ months, our last two board meetings, public health board meetings, I've asked for local data on hospitalizations of comparing breakthrough cases and those previously infected, or what I think most people would consider natural immunity. And I have yet to receive any information there. So I have some questions I'll ask, whereas whether the resulting and strained local hospital capacity statement is accurate or should be used or not, or clarified.
Okay.
So those are my
Fair enough. I think we
concerns.
can do that. I have a pretty good sense about, you're talking about the last whereas right before the now therefore be it resolved.
Yes.
Let's see. Ted Colas or Kari, do you have any? I know we have some references at the end of this resolution. Would that be helpful to cite a reference?
Dr. Turbush, this is Ted Colas.
Okay.
In hearing some of the discussion from other board members, I would support adding the word voluntary. I think that the fear in the public is mandatory, and if we add the word voluntary, that clarifies it on an easy, quick glance to people that there's nothing mandatory in this resolution. Also, Commissioner Gonzalez's second point of the addressing the cities and municipalities, like Kari, I don't think that's a hill to die on. That's nothing that needs to be in the resolution. This is coming strictly from the Board of Health, and if we state it as just from the Board of Health without making those other references, I'm fine with that. Otherwise, I'm in support of the resolution.
Okay, appreciate that. Let's move to Council Member Sam Geek.
After listening to Ted and his comments, I'm in support of exactly what he said.
Okay, thank you. Council Member Dave Donaldson, please.
Hey, Dr. Turbush, I'm curious if we're going to hear from the people who are signed up to speak before we vote.
No, the plan was, according to the agenda, is to go ahead and address this resolution, and we're going to have the public comment at the end. I think you can probably see how we need to, with 200 people out there ready to make comment,
Okay.
I think we can afford the time. I think that the Board of Health, though, has the background and the experience and the qualifications to see this through. So no, the agenda is public comment after the resolution. Do you have any comments about the resolution?
I'll have a couple, but I spent 5 hours listening to citizens' comments on a bill yesterday, an ordinance about pet stores. I'd be happy to sit and listen to what these people have to say for their time. And if they aren't allowed to speak before we vote, then I certainly won't say yes to this. And I invite the other board members to simply postpone this. If we don't have time to listen to them, there's no rush that this has to be done today. Specifically, though, yeah, I would need more time to support it. I am still concerned about blanket statements when I'm not. I haven't had time really to look this over completely. And what you read, I would say, is different than what I'm holding in my hands. Okay, and I've seen other people online saying the same thing. And I believe Dr. Vu was referencing that also. It's not just the numbers, but some of the language in this resolution is different, what you read, than what I have here.
Well, that's a problem.
It is a problem.
Okay. Do you want to read the resolution?
I do not want to read the resolution.
Okay, well, I have the one here that has the updated numbers I found, and the first two sentences under whereas El Paso County Public Health recorded 103,551 COVID-19 cases in El Paso County between March 1, 2020 and November 4th, 2021. And whereas public health has also recorded more than 5,323 hospitalizations and 1,147 in El Paso County due to COVID-19 during the same time period. Is that
Dr. Turbush, this is
Yeah.
Kari, right? I think that's even an outdated. The numbers obviously keep changing. We got an updated version just today, just before the meeting. So if I can read those updated numbers if you want.
okay? We'll have to pick a date, but yes, Kari, go ahead and read those numbers.
Pick a date, right? Well, I think what's of significance here is that original version is what Ted and I submitted to the department, and at that time there were 1,080 deaths, and the data that Vicki sent us out November 9th, which was yesterday, there were 1,170, so 90 more deaths in the span of a couple of weeks, which I think kind of proves the point of what we're trying to do. So, I mean, I'll read those numbers if you want, but just for the clarity of the board, we're being updated as the time goes by. So that's the change to this.
We've had to do that before with previous resolutions, updating to the most timely data. Yes, why don't you go ahead and read those first two sentences,
Okay.
Whereas, okay?
So the first two whereases were.
But you know, Dr. Turbush, those first two whereases, except for the numbers, are the same as what I have here. I believe it was the third and the fourth, our stuff started to become different.
Okay, are you good that we correct the numbers before we vote?
Yeah, that's not going to be the stopper for me. I mean, the problem for me is, does it say anywhere in here that this is a decision that should be made between the doctor and a patient?
Okay, all right.
Well, it's a question. Does it say that?
To Councilman Donaldson's point, Dr. Turbush, the original version that you read is different because it's gone through revisions through me, Ted, people at the health department. So he's right that some of those whereases are not quite the same. There have been edits.
Okay.
May I, real quick, Dr. Turbush, forgive me, and make a proposal?
Go ahead.
Well, let me go after Commissioner Bremer, please, because I see that she's been trying, and then I'd like to jump in.
George.
Okay, Commissioner Bremer, go ahead.
Thank you, Susan and Dr. Turbush. I concur with Councilmember Donaldson that we really should have public comment before we cast a vote. But I think there's an interesting point here. There's public comment for items that are not scheduled on the agenda. And then there's public comment prior to a vote for people who came to talk on that item on the agenda. And I think we can clarify that if somebody's here to talk about schools or masks or something else, they can do that during comment for items not scheduled on the agenda. But I think before we cast a vote, we really should hear from those that were here signed up to talk on this particular proclamation, and then give our final comments and cast our votes.
And
that's
if
just
I could just say something too, we've always had public comment after resolution voting, and I can't stay on until 5 o'clock. I have a 4 o'clock appointment today, and so I don't understand what the issue is. Maybe Susan or Kari. I did download the most recent resolution. Someone could read it, and it can't be that complicated or that different from what you originally received. I mean, I just don't understand this, and it just doesn't seem like rocket science.
What I was going to say was, is it possible to I don't know, take a 5-minute break? I would like to request that the most updated copy of the resolution be presented on Teams so people can see it as you read it. And then also, Doris, if you're not able to, listen to public comment or want to make a vote in support of that, then that to work that out. But with the comments from City Council member Dave Donaldson, as well as Commissioner Bremer, related to hearing public comment. And I'm seeing a lot of requests to have public comment before the vote is taken. And so I just wanted to point that out.
Okay. That sounds good to me. The two parts, let's take a little break and post the most recent version so there's no confusion about what it is that we're talking about. Go through that again if anyone would like us to, and then let's take a vote right now. Would the majority of the board like to have comment after Board of Health member comments, or wait until for or against this resolution? And I'll go down the horn. So the question that I'm going to propose is, do you want to have public comment before we vote? So Commissioner Gonzalez?
Before the vote.
Okay. Fire Chief Ted Colas?
Before the vote.
Dr. Vu?
I am neutral on that.
Okay. Doris?
After.
After. Okay. Kari?
I have no problem hearing public comment before we vote.
Good. Okay. I didn't catch that. I'm sorry.
Short answer, before the vote.
Comments before the vote. Okay. And Sam?
I'm fine with before the vote.
Okay. I think we know Councilmember Donaldson's feeling, and Cammie, we heard from you as well. So the majority of board members would like to hear public comment before we, the Board of Health, make a final decision on this. So that's what we'll do. So let's take a 5-minute break, post the most recent copy of the resolution, not only to the website, but just so that all the board members know which version we're working off of, and come back on in about 5 minutes. Okay.
Joining.
You have the resolution displayed on my screen, and I posted a link from our website in the chat.
Okay.
Were you going to read it and I can scroll?
Okay. And do we have the board members back?
Yes.
Okay. Well, let's go ahead and begin again. And yeah, I'm sorry for any confusion on that. We certainly need to be working off the same sheet of music here. So here's the resolution, and we are going to take public comment after this, and then we'll proceed to a vote if it's time. So this is effective date, November 10th, 2021, resolution of the El Paso County Board of Health in support of COVID-19 vaccinations. Whereas El Paso County Public Health recorded 105,409 COVID-19 cases in El Paso County between March 1, 2020 and November 9, 2021. And whereas Public Health has also recorded more than 5,418 hospitalizations and 1,170 deaths in El Paso County due to 19 during the same time period. And whereas data and analysis from sources regularly relied upon by medical professionals in El Paso County, credible data from trusted sources find the Delta variant of COVID-19 to be more transmissible than the original virus. And whereas widespread vaccination is a critical tool to help stop the COVID-19 pandemic, and whereas the Centers for Disease Control and Prevention recommends everyone 5 years old and older get a COVID-19 vaccination to help protect against COVID-19. And whereas trusted sources find that COVID-19 vaccination helps reduce the risk of severe illness, including hospitalization and death, and can also help protect people around them. And whereas widespread vaccination is a critical tool to help stop the COVID-19 pandemic, and the Centers for Disease Control and Prevention recommends everyone 5 years and older get a COVID-19 vaccination to help protect against COVID-19. And trusted sources find that COVID-19 vaccination helps reduce the risk of severe illness, including hospitalization and death, and can also help protect people around them. And the Federal Food and Drug Administration reported that authorized COVID-19 vaccines have and continue to undergo the most intensive safety monitoring in the United States history. And the Colorado Department of Public Health and Environment also reports that authorized COVID-19 vaccines were evaluated in tens of thousands of participants in clinical trials. The vaccines met the FDA's rigorous scientific standards for safety, effectiveness, and manufacturing quality needed to support approval or authorization of a vaccine. And whereas clinical trials for authorized COVID-19 vaccines included a more diverse group of subjects than previous trials for other drugs and vaccines, the population studied closely mirrored ethnic groups in the U.S. population, and the trials also studied, next page, the vaccine's effect in people with certain chronic conditions, including diabetes and heart disease. And whereas public health offers COVID-19 vaccines to eligible persons free of charge, reducing barriers such as technology, geography, language, and transportation, and expanding easy access. And whereas colder weather means more time indoors where more people may congregate in close proximity and ventilation may be poor, which can increase the risk of spreading COVID-19 with a higher risk for unvaccinated or not fully vaccinated individuals. And whereas in October, unvaccinated or not fully vaccinated individuals made up approximately 80% of COVID-19 hospitalizations in El Paso County, resulting in strained local hospital capacity and limits on regional resources for surgery and other medical procedures. Now, therefore, be it resolved by the El Paso County Board of Health that the Board of Health hereby finds that the best individual and community prevention measures to avoid serious illness, hospitalization, and death from COVID-19 is getting fully vaccinated against COVID-19, and that the Board of Health encourages the governing boards of El Paso County and municipalities within El Paso County to advocate for and encourage El Paso County citizens to be vaccinated, and that the Board of Health authorizes each of its individual members and the Public Health Director of El Paso County Public Health to advocate in support of the use of authorized COVID-19 vaccinations on all eligible persons. And Board of Health members, this is the one that we're looking at. And apologize for any confusion on a previous version. This is the one we're considering. And any other Board of Health member comments before we go to public comment? Okay, then I believe that Paula Lynn Harris is going to be able to go ahead and
Yes.
work out which speakers are first. And again, just if you would please let us know who you are, if you're associated with a particular group. And I'm going to also ask that people identify themselves as either residents or of El Paso County or not. I think that's really important. It's that we know when people from outside the county are perhaps speaking. And then please limit your comments to 1 minute. I know that's not very long, but I think with the number of people who'd like to make comments is probably the only practical way to do it. So Paula, can you go ahead and start with the folks that signed up early, and then we'll go from there.
Sure. First person is Erin Thompson. If you're on the line, please unmute yourself. Next person is Raymond Lyle. Next person is Nathan Heater.
Councilman Donaldson, I think you should tell them how to unmute themselves if they're on phone. Do they need to do *69 or anything like that?
Good point.
That is a good question. Vicky, do you know the technical on that if they're on the phone?
*6.
*6.
And then I would ask you to start over to give those first statements.
Sure.
And give them a little more than 5 seconds. Most people can't figure it out
Okay.
that fast.
Okay. Erin Thompson. Raymond Lyle. Nathan Heater. Kathy Mills. Stacy Vargas.
I'm right here.
Okay.
Great. Welcome. Welcome, Casey.
Hi, I'm actually Stacy Adair. That's my old email, and I'm a resident of El Paso County. I represent myself. Public health, I want to remind you that you are a department. No one elected you. You do not represent the people. Public health repeatedly delivers the mantra, trust the science, over and over and over and over. A resolution is just another page out of your repetitive propaganda playbook. By trust, you mean trust Pfizer? Here's a few data points from Pfizer. Pfizer received the biggest fine in U.S. history for mispromoting medicines and paying kickbacks to compliant doctors. Pfizer paid $430 million to settle criminal charges that it had bribed doctors to prescribe its epilepsy drug. The most curious data point for today, Pfizer paid 5,000 doctors and other medical professionals $20 million for speaking on Pfizer's behalf. By trust the medical professionals, is this what you are referring to? The doctors who were bribed to prescribe epilepsy drugs, the doctors who expected kickbacks? I'll pass. I'll continue to research. ask medical and health professionals that I trust and make determinations for my body and my health. You can keep your condescending attitudes and the guilt trips that would make every grandmother proud.
Okay, Stacy, this is Dr. Turbush. In order to be fair, we're going to have to limit it to 1 minute. So thank you, and we'll move to the next public commenter.
Mary Louise Fiddler.
Can we not
Yes,
start the 1 minute? Can we not start the 1 minute till after we tell you our name and if we're with a business?
Sure, that's fine.
Hi, I'm Mary Louise Fiddler. Can you hear me?
Yes.
Yeah, go
I am from El
ahead
Paso.
and introduce yourself and tell us if you're with the group, and we won't start the timer until you are done with that.
Okay, thank you. My name is Mary Louise Fiddler. I am a resident of El Paso County. I have children here in El Paso County, and what's going on, decisions made on behalf of my family and my kids are really important to me, and so that's why I'm here.
Good, thank you.
Okay, so what I liked about what was said is you will help to make the best decision for families, that you're not mandating vaccines, that you want to reduce barriers to health, that people are free to choose, and that one of the tools available are vaccines. So what I hear in this resolution is an advocacy for the vaccines. I didn't hear anything about any other protocols that have been shown to be effective. I'm wondering why there isn't any information. Dr. Vu said the vaccines are safe, effective, and save lives. I'm concerned that there is not information about, in my research, very clear instances of harm done. So I'm concerned about that and your advocacy for the vaccine and no other protocols. Thank you very much.
Okay, thanks for your comments. Appreciate it, Mary. Yes, next.
Marilyn Leal. Leal.
I'm here. I
Great.
am a resident of El Paso County, and I'm a healthcare provider. The people of El Paso need a resolution supporting injections of any kind, increased rates of function decreasing side effects. The report side effects are smeared as disinformation or misinformation, but in reality, those injected are deprived of legal informed consent. Full consent requires a notification of side effects and adverse reactions. Compassion for the community should be based on full consent. This is a smallpox vaccine. These injections have not been tested as a smallpox vaccine was. This resolution instills a confidence in a treatment with for COVID vaccine side effects in children. No long-term studies in adults. You have no data on children with vaccine side effects admitted to Colorado Springs hospitals, and the result will be between vaccinated and unvaccinated. We all know how statistics can be twisted semantically. If hospital beds are reduced because of decreased staff and a floor is closed, then of course the statistics of filled beds rise. We know that COVID rates are, this resolution is about health. If it was about health, you wouldn't need a resolution.
Okay, thank you. Thank you, Marilyn. Next.
Judy Birschbach. Carla Wilder. Marcy Little.
Allison. Cashel.
Is now exiting.
The Frequency Colorado. Rod Bears.
It's a Paula, Dr. Turbush. Give them, say, 10, 15 seconds at least to come off of mute. So I would hate to think that this is, that we're missing some folks who've stayed on this long.
Okay.
And Paula, please remind them how to get off mute with a *6. Each time you call
Sure.
someone's name, tell them how to.
No problem. The frequency Colorado, if you're on, please press *6 to unmute. Rod Beers. Nikki McConaughey, *6 to unmute. Judy Dunfield. *6 to unmute.
My name is Judy Dunfield. I live in Monument, Colorado. And I would like to say that your focus as the Department of Health needs to be on what people are eating. There's nothing about how what people eat, how they eat, their healthy habits are concerned for you. This vaccine is an experiment, and I don't want my family or my granddaughters exposed to it. And it should be our choice, not your choice, not a cookie cutter choice of my or my family's medical situation. Thank you.
Thank you.
Will Vandermeer, *6 to unmute. Stacy Curtis.
Yes.
Adriana.
Is now exiting.
Melanie Tessier, Melanie Tessier, *6 to unmute. Joe Denning. Ronnie Pickens. Janae Winkleman.
Okay, we have Adriana here. I think you just called her. Just one moment.
I don't recall seeing her name, and I'm trying to go in order of request. Nathan Heater.
They don't think they called you. They called you. Okay.
Alexander Kelsey, *6 to unmute. Linda Gunther.
Hey, Dr. Turbush, this is Councilman Donaldson. Hey, I have a hard time believing all these people signed up to speak and then went away. So I think there must be some problem here with them not being able to somehow access this platform. I don't know exactly how they're supposed to do that. I had someone just text me and ask how this works. So we're probably getting what, 1 out of 10 names that are called to respond. So I think
Probably,
there's a
yeah.
real problem here.
I think there is a way that we can make best use of the time. I think there's a room that we have a TV set up, and if we shifted to that room where there are folks that are ready to speak, and at the same time tried to deconstruct what's happening on the other chat. Maybe we could get them all in. So
I think that's a great idea.
Is that?
But can someone explain to them how to do it?
Yeah.
The other thing too is that people may have better clarity on the intent of this meeting, had signed up earlier before they got that clarification. So that might be
That's
part.
clear that actually asked to speak this morning before 9 a.m. and never heard anything back.
Okay. Let's.
Janae Winkleman is here.
Paula, if it's not too hard, let's go to the room where there are a number of people who have assembled to make comments. And then while we're doing that, if we can kind of figure out why the system for the other people is not working. Is that fair?
Joining.
Sure. So I will read off the names of the people who are in the room
Okay.
at present in just the order that they appear on the screen.
Excellent.
Okay, guys, it
Thank
sounds
you.
like they're bringing us all upstairs to speak. So it's going to be just a couple minutes and this room of 75 people will be ready.
Could I go ahead and speak? I requested line to speak while we're waiting.
Sure. Hello, you just called my name?
Oh, let that person go.
Okay. Who's speaking? Janae?
Okay,
Yes,
go
I
ahead,
can speak.
please.
Okay, Janae Winkleman, I'm a citizen of El Paso County. I have the concerns I share as one of Dave Donaldson of the boards of health not having recommended a single source of treatment. Just concerns about what the next step is, and would you base stricter decisions regarding vaccines on your recommendation proposed today? I'm also concerned about the recommendation for kids ages 5 years and older, as there are no long-term studies or data available regarding the side effects. I my children are both in this age group, and I do not plan to vaccinate them because of safety concerns, but I am also a parent that is not anti-vax. My children also are otherwise fully vaccinated. I also don't believe it is a child's responsibility to protect adults from COVID-19. Lastly, I appreciate the update on the antibody treatments becoming more widely available and making them easier to access. It bothers me when I get the impression that we are trying to do things to prevent any cases of COVID. We are stuck with COVID and we'll always have cases, and that is why I feel it's very important to include therapeutic treatments when you're making recommendations and advocating for public health.
Okay, thank you. Thanks for that comment.
Yes, this is Dr. Brady. Can I speak?
You're up. We hear you. Go ahead.
Excellent. Thank you. Dr. Nathaniel Brady. I'm a clinical immunologist here in Colorado Springs, as well as a resident of Colorado Springs. I would like to echo many of the comments that have previously been given as far as concerns for long-term safety. I do have some data to share from the CDC that was questioned from Dr. DeStefano that did not have the data. In the 5 to 11-year-old category, according to the CDC of 2 weeks ago, 1.9 million cases of COVID had been reported. That included 8,300 hospitalizations. That's an incident rate of 0.4%. Also 84 deaths. This is nationwide with a rate of 0.004%. If we assume that the case rate is at least twice that, because most children are asymptomatic and would not have been tested, those rates then drop to 0.2% for hospitalization and 0.002% for death rate. So that is the data. That is the whole nation. And
Adriana
so the hospitalizations
is now
of
joining.
2,000 for Colorado, those are cases that are positive with COVID, not from COVID. Those are included in children that are hospitalized for other medical reasons, including broken bones and other surgeries, because they are screening these children for admission. And if they test positive, that gets counted as a positive COVID case, even though they may be asymptomatic. And final closing, no one size fits all in medicine. The decision is best between the patient and the doctor. Vaccines are for the individual. They are not for the community. Asymptomatic transmission has been shown to be as high, if not higher, in those that are vaccinated with no symptoms as those that are unvaccinated. So we have to stop this vaccines that would protect other people, including children getting vaccinated, protect adults. Thank you.
Thank you, doctor.
Okay, I
Hello,
will
this is
resume.
Sharon Ballinger. I've requested to speak also.
Okay, I will read in the order of how folks are listed on Teams and then revert back to the order of requests on our email today.
Okay, go ahead.
Jerry Forte is in the room. You can unmute yourself with, yes.
Hello? Can you hear me?
Yes.
Hi, I'm
Yes.
Jerry Forte. I'm a resident of El Paso County. Ivermectin, hydroxychloroquine, and monoclonal antibodies all have numerous studies supporting their efficacy. The data suggests this is a very treatable disease. Both the NIH and recent studies say natural immunity is as good or better than the vaccine. An unprecedented number of injuries and deaths. I know people personally who have died within 48 hours of the shot. The vaccine doesn't work well enough, lasts long enough, and is not safe enough. I request you reject this resolution pass. That I request the additional acknowledgement of the real safety concerns, the efficacy concerns, the available therapeutics, the recognition of natural immunity as a viable, the insertion of the word voluntary. Thank you.
Thank you, Jerry. Okay, next.
Next person with the initials BF.
BF.
B as
Sorry
in
about
boy.
that. I thought I put my name in there. This is Barry Farah. Thank you very much. I am a longtime resident of Colorado Springs and love it here. Thank you for your service on the board. I have two whereas suggestions. 10th whereas, kind of putting your money where your mouth is type of whereas. Whereas public health will not directly or indirectly mandate the COVID-19 vaccine. And then another whereas public backs all science and endeavors to make this resolution with humility. Public health encourages each citizen to evaluate their particular health situation with their physician in concert vaccine adverse event reporting system data. And then finally, I have one notwithstanding, and I put under your actual resolution. Notwithstanding any other encouragement from public health, El Paso County Public Health will not interfere in a citizen's health decision resulting from consultation with his or her health professional. Thank you very much.
Okay, well, thank you. And I appreciate you being organized like that. We are recording these comments, but if you could, if it's not too difficult to type that into the meeting chat.
I've got it right here. I'll just copy and paste that in.
Would you?
You'll be
Okay.
good to go. Thank you.
Holly Lucken. She thinks that she got skipped, but she was next on the list, so there must be something awry on her end. Holly? Are you still there, Holly? *6 to unmute. Okay, I'll move on, and then if she gets back on, we'll circle back.
Okay.
Jim Lena? Jim Lena? He's in the room. Felicia Miller is in the room.
Hi. Hi, yes, I'm here. Can you hear me?
Yes.
Yes, welcome.
Thank you. I'm Felicia Miller and I'm in El Paso County. So I first want to say that I strongly support there being no wording for mandatory in this resolution. At the same time, I strongly support that there needs to be wording that states that this is a voluntary decision made between an individual and their family. You guys stated previously that the vaccines, and you actually stated in this document as well, that the vaccines are meant to stop the spread, but the CDC has actually even said that it does not stop the spread. It actually reduces. Therefore, less likely to know that they're carrying the virus and is more acceptable to spread it to others. So that is what I wanted to say, but then I also had questions to the board of what is the point of this resolution? If this resolution is solely to get in the wording that no doctors can deny an individual based off of inability to pay, then why are we not just stating that? Why is there so much other wording in here if that is what we're trying to, is that the purpose of what we're trying to pass with this resolution?
Is now exiting.
Okay,
Dennis Cole.
thank you.
Yes, Dennis Cole, I'm here.
Okay.
Go ahead.
Yeah, I'm a resident out in the county here in El Paso County, and I don't really have much to say. What Barry Farah said, I would be 100% in agreement with his additions to the resolution. A couple thoughts were from Dr. DeStefano. He was a strong advocate of immunizing children, but I looked up in the CDC website as this meeting was going on. And if I've looked at it correctly, the total number of deaths for youths aged 0 to 18 in the US to date from COVID is only 700 out of a population of 8.9 million, which equates to about 0.008%. So I just feel like there needs to be, that we're careful not to advocate for that age group, because I just don't see that as that age group is really at risk. And the one question for the board is, what significant result or change in public behavior are you expecting from this resolution? Thank you.
Okay. All right. And again, put that in the chat if you wouldn't mind, particularly your question. Okay.
Absolutely.
Next person, Holly Luckin. I understand she's returned to the room. *6 to unmute. Holly? I'll move on. Dennis Cole.
I think did we hear from?
Yeah, just gave you my comment.
Kimberly Hershey.
Yes, ma'am, I'm here. Can you hear me?
Yes.
Hi, my name is Kimberly Hershey. I am a homeowner and resident in Colorado Springs. I agree with some of the other voices. I am concerned that no alternatives were even mentioned in this resolution. And one question that I have is, will this resolution be used to support a mandate in the future? It seems the verbiage is very pro-vaccine, and I'd like to state I am not at all anti-vaccine. I am fully vaccinated, but this is not the same as vaccines that have been studied, that have been trialed, that have a history of proven efficacy, proven side effects. This is not the same. You cannot absolutely, in good conscience, treat this as the same as everything else. And I think that's what a lot of these voices are concerning right now. This is not just a vaccine, and these measures that are being taken right now is very frightening for what they are leading to. That is all. Thank you.
Okay, thank you.
Holly Luckin.
Can you repeat that, please, Paula, that name?
Holly Luckin, Lucken.
Can anyone hear me?
Is this Holly?
No.
Okay, go ahead, Paula.
I'll go in order. The next person with the initials NB. *6 to unmute. Next person, Laurel Ann.
I'm the interpreter, and I'm supposed to be taking over the other interpreter for Kevin, but I can't contact him because he's too busy working.
Okay.
Laurel Ann.
Hi, this is Laurel Ann.
Oh, okay.
Hi. This resolution does not represent the full body of medical data. This resolution is not about mandating vax, you say, but it is a step towards it. This resolution does not represent the will of the people. It is a political move in direct opposition of the county commissioner's resolution the other day. This resolution does not address proven medical practices of boosting immune systems and other critical tools like exercise, diet, sleep, even socialization. I am calling on Kerry to resign for usurping the county commissioners and for Dr. View to recuse himself because he stands to extensively financially profit from this resolution.
Mm-hmm.
The point was made. Well, this a resolution is inappropriate and it accomplishes nothing. We have no need for a resolution like this. To combat misinformation, share the information, all of the information, not just the information that supports your emotional agendas.
Okay, thank you. Thank you. Next person.
Wendy Selvig.
Hello, can anyone hear me? Is my microphone working?
Yes, if your name was called previously.
Yes, Jim Lena, can you hear me?
Yes.
Okay,
Yes.
great.
Go ahead, Jim.
Okay, great. I'm a resident here in El Paso County. My concern is that this is a brand new technology, messenger RNA vaccines, and we're not being told what's in them or how they're being delivered to us. I have 3 patents that I printed out this morning of drug delivery systems. These are what's being used in the vaccines, and I think people should know what's in them. This one here is called the magnetic nano drug delivery system. These are nanoparticles. Here's another one, nanoparticle, and here's a little diagram showing what it is. These are very tiny little things that are injected into the bloodstream. They're going into your heart, they're going into your mind, into your brain, I mean. This one here, all these are US patents, by the way. Anyone can look them up. This one is graphene oxide. It's under the name of single wall carbon nanotubes. Here's a chart by VAERS showing death rates from 31 years of previous technologies and their deaths. This big gigantic spike here is from the COVID-19 vaccines. This is reckless. This is very reckless, and people need to know about it.
Okay, thank you. Appreciate it.
You're welcome.
Wendy Selvig.
Ma'am, can you hear me?
Yes, we hear you.
Okay, thank you. My name is Wendy Selvig. I'm a homeowner and resident in El Paso County. I'm a mom, and I'm very concerned for the people of Colorado. The research we hear seems to be very one-sided, pro-vaccine, and I am concerned about how we don't hear about the risks and concerns that there are very established medical doctors out in the world voicing concerns, and we hear none of them here in this meeting. The biggest one that I am concerned about is immune deficiency enhancement, which means that if you've been vaccinated and don't keep up with your boosters, your immune system is impaired, which apparently it seems like for life. And you are at risk for many illnesses in the future. This is harmful for our citizens of El Paso County to promote this vaccine. And I see if you guys vote on this, I see you as promoting harm to our citizens by promoting this vaccine. There's a lot of information and data, which I'm happy to post in the comments from the UK Health Security Agency, formerly Public Health England, that shows most age groups, the new infections are not the same between vaccinated and unvaccinated. It's indicating the vaccine is not showing any benefit in terms of preventing infection. I'm out of time. Thank you.
Thank you.
Trying Holly Luckett again.
I think maybe Holly left. Go ahead.
If there are any additional people on who would like to comment, can you raise your hand?
Yes, my name is Sharon Ballinger.
Go ahead, Sharon.
Thank you for taking my call. I'm a resident of El Paso County for 25 years. I have 7 points to make quickly. 1, this is new technology. mRNA has not been used long enough to risk anyone, much less our children. 2, the truly approved version of the vaccine is not available to most people. The other versions of the vaccine are emergency use authorization only and come with no liability from anybody. Would you buy a brand new car without a warranty? 3, UK studies are showing that those that are vaccinated are helping to spread the disease itself. 4, vaccinated people are getting sick. Such mandates used to allow for religious and medical exemptions. This one does not. Your immune system does become compromised. With all of that information at hand, citizens cannot help but wonder why you or anyone else would suggest that we do this to ourselves unless it was for nefarious reasons that either so greatly profit you or so detrimentally harm us that it benefits some purpose that no one will describe, because otherwise it would bring us into full-out rebellion. Thank you for listening.
Okay, thank you.
Next person, Kayam Goldman. Star 6 to unmute.
Hi, I'm on video. Hi, this is, can you hear me?
Yes.
Yes.
Hi,
Please.
this is Iam Goldman. I am a resident of El Paso County. I have been listening to this meeting in absolute disgust. It seems that you've already made up your minds, and the fact that you wouldn't take public comment or didn't want to, I don't even know why we're making comment. After not even knowing what the document was that you read, and that it didn't seem important, the wording of the document, it's very confusing why this is here in the first place. The science has been presented. We don't know what this is, and every single statement within this resolution is not factual. You can cling, whereas stated as fact is actually conjecture. No, there have been no long-term studies. This really is incrementalism at its worst. You are trying to force something in order to influence our community when the facts are not being fully presented. This should be tabled immediately, and there can be proper public
Is now joining.
if you care about public comment.
Thank you.
Next person, just have a first name, Daniel. Daniel, star 6 to unmute.
Hi, he's coming over. Sorry.
Hi, my name is Daniel Fennelson. I'm here on behalf of my wife, who is a labor and delivery nurse here in El Paso County. We are both residents of El Paso County. She has chosen not to be vaccinated with the COVID vaccine, and it's none of your business to know her motives or her convictions on it. My wife and I's statements are not about the vaccine, but they are about the last meeting on October 27th, which had highly inappropriate comments from 2 board members, including a comment by Kari that this resolution is a direct response to the commissioner's proclamation.
Unknown participant
First,
is
I want
now
to thank
joining.
Commissioners Gonzalez and Bremer for voting on the county proclamation and fighting for medical freedom, even while Dr. Turbush issued insults and manifestos demeaning unvaccinated healthcare professionals. Second, I want to say thank you to Councilman Donaldson in Liberty while being rudely and incorrectly interrupted by Kari in the last meeting. Lastly, Kari, your dismissal of healthcare professionals who disagree with you and your disrespect for other board members shows how closed-minded and immature. It is disheartening to see you in a leadership position. Dr. Terry, you called my wife and other unvaccinated nurses selfish, which proves you are either ignorant or will deceive to reach a political end. Both of my wife and other nurses yet complain about staffing shortages. You both should stop acting like children and bullies and address the issues at hand.
Okay, thank you, Daniel.
Hi, my name is Maddie. I also sent in the email this morning, so I would like to speak as well.
Hi, Maddie.
Hi, so my name is Maddie Fennelson. I'm a labor and delivery nurse here in El Paso County. I am unvaccinated and yet remain caring for my patients to the best of my ability. I want to ask, how is it that I am selfish as I go above and beyond for each patient in my care? How am I selfish as I signed up for an extra 156 hours in the span of 3 months on top of staying late for shifts and additional on-call shifts? How am I selfish as I care for people around me as I make them food when they have a hard time? How am I selfish when I volunteer to teach high schoolers about STIs on my few days off? Am I selfish because I won't take a single shot that does not change the ability to transmit the COVID-19 virus to others? Or am I labeled selfish because I will not comply with something that contradicts my personal faith and logic? Kari, your statements of not even knowing about where the morgue was before COVID-19 at Memorial Central are truly laughable. I worked there before COVID and was going to the morgue was a frequent occurrence. Your ignorance, arrogance, and immaturity is apparent in nearly every comment you make. Please don't make this nursing shortage worse. Our hospitals are drowning and have beds, but because we don't have nurses. And don't demonize us who choose to remain unvaccinated because it goes against your personal belief.
Okay, thank you. Thank you, Daniel.
Kimberly,
Rick,
sorry.
Hi, this is Dr. Vu.
Yeah, Rick, go ahead.
I would like to request for us to continue to listen to public comments and for public comments to avoid degrading remarks towards members of the Board of Health, please.
Thanks, Rick. Thank you. Okay.
Kimberly
Paula?
Glowacki.
Paula,
Yes.
go ahead.
Kimberly Glow.
Dr. Turbush, if I may. This is Jared Brenner. I'm at the building. We've got 5 people here. Can we go in and get these 5 people in the mix as well?
You've got about
There's
70
dozens out
here.
there that want to talk as well. They're going to funnel in. We've got like 50 people.
I'll continue on the list. Dr. Turbush, if you want, or should we revert to the people in the
No,
room?
I think if you have a list there of people that have signed up, why don't we continue with that, please?
Kimberly Glowacki. *6 to unmute. Todd Watkins.
This is Holly Luckin. Can you hear me?
Yes, Holly, go ahead.
Okay, I apologize. I was having issues with my computer and I had to dial in.
No problem. This is not that easy. Go ahead.
Okay, if you could just not start the timer until I finish this first part, I'd really appreciate it.
Okay.
This is directly to the board. First of all, as you know, my name is Holly. I'm a nurse that lives in El Paso County. I represent myself and I'm expressing my personal concerns and experiences, and I want to thank the board for holding this meeting. I appreciate that the board agrees that this needs to be a choice, although I have a grave concern for how the resolution is worded. It states that the Board of Health encourages the governing boards of El Paso County and municipalities within El Paso County to advocate for and encourage El Paso County citizens to be vaccinated. I think that it also needs to state that this is to remain voluntary. I am very concerned about the possibility of mandates, but I do, however, support voluntary informed consent of vaccinations. People need to always have a choice. Now, let me explain why I called in today. I have a strong conviction. I am an RN. In September of 2013, I was vaccine injured after receiving my flu shot at work. Although I had great reservations of taking it that year, even though I had my first flu shot in 2012 and had only had generalized muscle weakness at the time. I wish I would have listened to my gut, but went against my better judgment in 2013. Within 24 hours of receiving the vaccine, I was diagnosed with a reflex sympathetic dystrophy, also known as complex regional pain syndrome. RSV has an autoimmune complex. Anything that triggers the immune system, even the slightest little injury, can trigger that beast. I spent the next 4 years in the most horrific battle of my life. Although the pain started out in just my pinky, which, yes, doesn't sound like much, it was an excruciating burning pain. Hang on, if you could please give me one moment. And pain like I have never felt before.
We're going to need to bring this.
Colored and swollen.
Okay, we're going to need to bring this to a close, please. Thank you.
Steve,
This
initial
is Kimberly
Y.
Glowacki. It did not unmute me earlier.
Okay.
Hello? Okay,
Yes.
can you hear me now?
Yes.
Yeah.
Okay, I am a human being who happens to own a home in El Paso County, and I am here today to ask that this resolution be tabled until it is comprehensive and balanced based upon evidence. I believe that you are not presenting accurate information when you use the adjective, quote, the best. That is not accurate medical information. I believe that you need to be adding statements about effective treatment, early treatment, prevention in general, in terms of good health measures. As a public health entity, that is your responsibility to look at a full comprehensive picture. To protect public health, you need that early treatment, and your PCP needs to be empowered to help you make medical decisions. I have been to physicians who have told me they will not discuss informed consent. They will not discuss the vaccination. They will not discuss treatments. And that's a problem. So the Board of Health needs to be coming out with statements that are based on what we know about how to treat COVID as well. Thank you.
Okay, thank you. Thank you, Kimberly. Next.
Stephen
This is
Y.
yeah, thanks. My name is Steve Young. I live here in Colorado Springs. And I'd like to start out by echoing exactly what the last speaker just said. The lack of completeness in the resolution that's currently written is pretty laughable. So I have a few points to try to get through here in a minute. The first one is really, what is the point of this resolution? What does it actually accomplish? It appears, as many people have said, just to be one step closer towards making mandates easier from an incrementalism standpoint. There's also no statements to the effect of other treatments that have been shown to be more effective from an early treatment perspective. Why is that? Why are we only pointing at one thing? It seems like it's only a party line endorsement of the vaccine, which is suspicious at the very least. The data regarding safety is laughable. It's like trusting Ford that the Pinto was a safe vehicle. The safety and efficacy data from the shop manufacturers, when they initially released it, did not stand up in the slightest bit in the real world, and the VAERS database is showing that in large numbers. And there was no statement with reference to any of the adverse reactions and damage being done by the vaccine. So if we're going to even put this thing out for a real vote, it needs to include all the data, not just party line.
Okay, thank you.
Hi,
Jared?
this is Todd Watkins. I was here. I'm back in. Hello?
Todd, if you can hang on one bit, we're going to unmute the mic in Snow Miller. Jared Werner, please unmute the mic.
Thank you. Whoever would like to go, feel free to stand up there, same thing, introduce yourself, and if you're a resident, and then after that, the timer will start.
Hi, my name is Denise Kamillik, and I am a resident of El Paso County. And first and foremost, I'm horrified that you would put together an emergency meeting like this without having good information and allowing of this county. There are hundreds here, but there would be probably thousands if they knew what you were about to put together and in place. So that's first of all. Second of all, I am actually horrified by the medical experts that you have hired to give you insight into this quote unquote vaccine. It is not a vaccine. It is different technology. It does not use eggs and the regular things that vaccines do. This is completely different. So let me answer some questions that Dr. DeStefano did not. There were 538 deaths in the 18 months from COVID. We usually have over 400 deaths in youths under the age of 18 in 1 year. This vaccine was not designed for the variants, but only the first version. So you need to go to VAERS.com and you need to look up, there have been over 16,000 deaths from this vaccine. There have been 750,000 people that have been adversely affected by this vaccine. Why you are not looking into this is criminal. You need to sleep at night. Look at the VAERS.com, VAERS.com.
Okay,
Vaccine adverse event reaction record or whatever. Thank you.
Thank you. Next.
I'd like to speak. Can you hear me?
Is there anyone still in Snow Miller that wants to comment before I revert back to the list?
Looks like there is. Go ahead and give us your name and go ahead.
Yes, respectfully, I am Robin Rock. I am an El Paso County citizen. I do not trust science that is paid for by Big Pharma who benefits from the outcome. There is no data for counting natural immunity for El Paso County that I can find. I have natural antibodies. If there's somewhere where I can tell you and be counted, I would like that. I read many research documents and studies for research by a variety of doctors, both for and against vaccines. I find this information at the following website, ICanDecide.org. They have both for and against. I believe natural immunity is best. Best for me, best for my family, best for the community, and the best science we have.
Okay, thank you. Do you want to try and get to Jeannie Rush? She's been waiting a while.
Can you hear me?
We hear you, Jeannie. Go ahead.
Right, thank you. I apologize. I would like to introduce myself first. Jeannie Rush, Gammy Sparkles. I'm a mom, a grandmom, a great grandmother, been in the community for many years, and I love my community. And I love all you all trying to make it better for us in and outside the board, but I don't agree. So let me start my minute.
Please, go ahead.
I read your resolution this morning. It is totally, I'm against it. It's a gateway to mandates. Respectfully and humbly, I request for all our agencies to stop these unlawful and unconstitutional travels into the direction of mandates and promotion of vaccines on our youth and anyone, with a 99.9% survivability of this virus. And the protocols for anything other than remdesivir and ventilators is there. We have 50 states of doctors, frontline doctors, advocating for ivermectin and all the other benign protocols. And Dr. Malone, Mark Sherwood, Simone Gold, Brian Artis, Fleming, Mikovits, McCullough, Bregan, they're all telling us we have a way. So please look at the better ways. Thank you.
Okay. Thanks, Jane.
Is there anyone else in Snow Miller?
Thank you.
Yes, thank you. We've got a few more. So yes, thank you.
Well, we've got 17 here. They're in the hallway.
Go ahead, introduce yourself and let us know if you're with any organization or not.
Hello, my name is Andrea Roberson. I've lived in El Paso County 24 years and worked at medical office, primary care. My best friend is a physician and works for pharmaceutical companies as a medical researcher. I would like my time to start now and back up to 60, please. I just introduced myself.
We'll give you some extra time. Go ahead.
That many say we have misinformation, and I have my information from research, medical research over and over again. Follow the money, the scientific information paid for in the narrative on your TV and by the CDC, NIH, NIH, and AIH is funded with big pharma, big tech, big bank, big government, etc. And you're putting as medical doctors, we've put our faith in them for very long. My faith is in God, the word shalom. I come in peace, shalom. The letters of shalom represent communion. Eat the authority attached to the body and blood of Jesus. And this vaccination is in communion to eat and ingest the authority attached to the body and blood of a sacrificed child. And I do not want to be forced to be attached to the authority of hell that sacrificed a child in aborted fetal cell tissues. And these vaccines are used, and remdesivir is used in aborted fetal cell tissues, cell line products, in the production and manufacture thereof and the testing thereof. Thank you.
Okay, thank you.
Cut me off on volume? Okay, thank you very much.
Next person in Snow Miller.
Take myself off this double camera just a minute.
You're ready to go.
Okay, yeah, I was on a double.
Okay.
All right, hi there. I'm Charity McPike. I'm a citizen, actually a lifelong citizen of El Paso County. And I do very upset citizens that showed up today. The numbers would be much larger had we had any notice of the secret emergency meeting. So we're kind of frustrated, but are happy that incorrect email post or Facebook post went out this morning to warn us that this was taking place. The majority of us here are upset because we have COVID vaccination injury stories, some including death. My son has myocarditis after being lied to by folks in the science and medical industry and up at CSU. He developed myocarditis 11 days after his Pfizer vaccination. 3 cardiologists refused to file a VAERS report. They are not admitting that it's linked. This tells me, and it should tell all of you, we don't have the true science. We don't have the true vaccine adverse reporting going on. And this is unacceptable for you to push this on our community. We won't comply.
Okay, thank you.
All right. Next person in Snow Miller.
Hi there, my name is Tammy Klimek and I am a resident, homeowner, and mom of El Paso County. I just believe these decisions on mandates should be a doctor-patient discussion, not a mandated decision or even a persuasion from the city, state government, or public health department. My concern is that there is not proper long-term data showing the risk-benefit for individuals. Adverse effects from these vaccines have not been consistently and accurately reported so that people, we the people, feel that there is full transparency and are comfortable with this injection. To date, there have not been sufficient length of time for this mRNA shot. Just yesterday, I spoke with a friend who had at least 6 stories of family friends that had the shot. One within 24 hours died, and the rest within 60 days, having major heart issues, strokes, blood clots. Some as old as 26 years old. I would ask, also, are these adverse reactions being properly reported in the VAERS study? Nurses that I say there just isn't time in their day to document potential adverse effects. We, the people of Colorado Springs, say no, stop the propaganda for the shot, table this resolution, and let us make our own educated decisions. Thank you.
Okay, thank you.
Next person is Snow Miller, please.
I think that's it for Snow Miller, isn't it? Oh, there's one more.
Oh.
Hi, my name is Dr. Susan Rivard. I have been a member of Colorado Springs in El Paso County for 32 years as a practicing chiropractor with postdoctorate in neurology. I practice on head injured and brain injured patients. I had a busy practice today, only found out about this meeting at noon. I had to cancel my practice and come because I feel very strongly that this kind of last minute meeting is not in the benefit of the general public, not in the benefit of my patients. I have not had a chance to look at these studies that are called trusted and scientific, because I tell you, I have a computer full of studies that are also trusted and scientific that would say otherwise. I am for Dave Donaldson's tabling this. In fact, I am for stopping this resolution completely. Dr. Vu and Dr. Donald, or Stefano, I'm sorry about the names, are not in the trenches with healthy patients. I treat a healthy population who do not want to be vaccinated. They want their choice, and it's between the patient and the doctor. Stop this resolution, table it, do whatever you have to do.
Okay, thank you.
Next person is Snow Miller.
Y'all, Sergeant Brown here, we got 13 total here.
Okay.
Next person.
Hi, yes, my name is Angela Green, and I just want to say I'm also a TBI patient from last year. And because of that injury a year ago, I've been on a health journey to take care of myself. So a couple things that I feel like have not been addressed today are, and I can echo many people's voices on self-care and making sure that I feel like the health department needs to help us know how to take care of our bodies, nutritionally and physically. I am an advocate for myself, not just because of my last injury, but because of my own family's health issues and taking care. I'm actually 8 days post-COVID, and no one has mentioned the fact that ivermectin works. I am healthy. I have no symptoms, and I have been taking the vitamins that go along with the routine and the protocol. There are other things out there, and that the CDC and the health departments need to recognize for the people to empower them to take care of themselves, give them the freedom to choose what they want to put in their bodies.
Sharon Ballinger.
Okay, thank you.
Is now exiting.
Okay, just a quick message. I have a couple of people that they want to comment but cannot stay on the line for long. I would encourage you to send an email to boardofhealth@elpasoco.com with your comments. The next person is Snow Miller. Go ahead, Snow Miller. Next person.
Hi, I'm Tanya Regan.
Go ahead.
Online. My name is Tanya Regan. I'm an El Paso citizen. I have done extensive research. I sent a note to the board this morning. I'd like you to look at some of the questions I asked, but why are we considering this resolution
when clearly the medical professionals that joined the team don't have the data. They kept answering, I don't know, I'll get back to you. I'm asking that we look at other solutions, therapeutics. Dr. Robert Malone has always advocated a combination of perhaps the vaccine and therapeutics. At the end of the day, ivermectin, Qusera, are proven to be extremely effective against a COVID vaccine if it is in fact a real vaccine. I also ask you to look at the data that was mentioned before, the VAERS database. At over 13,000 to 15,000 people have been recorded deaths from this vaccine. I also ask that you look at the countries in the world who are the most highly vaccinated. Singapore, Israel are also showing the highest numbers of COVID outbreaks. Reoccurrence, they call it breakthrough. Thank you. And I ask you to table this resolution.
Okay, thank you.
Next person at the podium is Snow Miller.
If you're ready, come on in.
Hello, my name is Dr. Kent Robertson. I'm a family physician, longtime resident since '94 of El Paso County. I have practiced medicine in El Paso County the whole time. And you can go ahead and start the timer. I would like to encourage you to ask yourself a couple questions. Why do we need this resolution and why now? I would say it's unnecessary. I would say it is early. We still need more information, a little bit of background. I have a master's degree, which includes an emphasis in experimental design, and I've practiced researching pharmaceutical medicines for much of my career here in Colorado Springs. This, your whereas sections talk about efficacy. It relies on FDA, who is questionable at this point on safety. You look at VAERS, over 850,000 reports, 20,000 life-threatening events. I have been threatened as a physician with removal of my license, removal of my board certification, and there is no more need to do bullying. So table this or reject it. Thank you.
Okay, thank you. Let me just make a comment is that I would say the vast majority of the speakers today, the public comments have been well thought through and respectful and organized. And so I know this 1 minute time limit is difficult to collapse all the many thoughts and feelings into that period of time, but the folks who have spoken to this point have done a very good job. So thank you. Let's continue.
Okay, I'm Kathy Cleary. I am a resident of the county, and I would just like to dispute a few of the things that have been going on. For one thing, you probably can't see this. Here is my nephew at 43 years old, just a few months ago, died after getting the first Pfizer vaccine. His autopsy report says massive branching blood clots in both lungs. That is a fact. 27 days later, his mother passed away after 3 visits to the hospital where they kept sending her home, although she has chronic lung disease. She was given nothing but steroids. And when she was in the hospital and on a ventilator, I fought and fought and fought. They didn't even give her vitamins or her prescriptions that she's been taking for 30 years. Do you think we trust this system of doctors? Absolutely not. They're killing people. Here's the proof. If you want it, here it is.
Thank you.
Next person is Snow Miller.
Come on.
Come on in.
Now you're ready.
My name is Jennifer Duhan. I'm a resident. Only 700 deaths in this age group. This is a political move that is not consistent with the county commissioner or elected officials and represents a huge conflict of interest. That's the bottom line here. Vaccine injuries are not being validated by our government, and based on studies, there have even been more long-term effects that may possibly kill 55 million people worldwide in the next couple of years. The doctor at Children's Hospital should be ashamed of himself for supporting a shot which he has not even done his own research. Let me remind us all that the medical field is an art. Each situation should be decided individually. There's more studies showing negative effects of the vaccines than positive. Concerned at how parents' input has been completely overlooked and underrepresented by this. Parents' rights are not being affirmed, which is child abuse if they are ignored and resulting in injury or death from the vaccine. The bottom line is our constitutional rights are being violated, and these ongoing mandates and this resolution would not be good for the society, but quite the opposite. And my children would like to speak.
Thank you. Appreciate
I will
it.
not comply.
Thank you for your time.
Thank you.
Miller?
Just a moment, we have another one coming in.
Snow Miller, there we go.
Hello, my name is Barbara Gilson, and I'm a resident of El Paso County. And I just want to say that I understand the heart of what you're trying to do, but I really would strongly urge you to table this, because the idea of putting out a resolution for something that we know there is a lot of data out there in the VAERS database, and all those that have mentioned it, that there is a lot of adverse reactions to these. There are a lot of deaths to these. We had pulled vaccines before for far less deaths. We've pulled a flu vaccine for 25 deaths, and we've had more than that just in what's reported in VAERS. So the bottom line is, if you're going to make a resolution at all, then you should have everything that's possible. Ivermectin, hydroxychloroquine, diet, all the things that people can do. And a vaccine is not the only way. Thank you.
Thank you.
Next person is Snow Miller.
Four more in Snow Miller. Four more.
Okay, let's go to, I know there's a number of people that have a hand up and on the
Yes.
on the
And
internet.
before we went to Snow Miller, Todd Watkins was next up to speak.
Okay,
So
Todd.
if you're still on the line.
Yes, I am. This is Todd Watkins. I'm an El Paso resident. I represent myself. I strongly second 100% of the previous commenters regarding the myopic and agenda-driven science cited by this board. It is highly distressing that this bureaucratic, unelected body of civil servants would even consider passing a resolution without the advice and consent of the public whom you serve. It is further distressing that there are members of this policy-making body who have personal and moneyed interests in the decisions of this body. Your resolution today reflects nothing more than the personal opinions of the highly conflicted members of this board, not the people whom you serve. And that needs to be reflected in any resolution that you publish. And I'll yield my time to the next commenter.
Okay.
Dr. Turbush, do you want me to continue with the list or back to the room?
I think the room is empty. It looks like it to me. Let's continue with the list, please.
Hey, Dr. Turbush, I'm sorry. They're in the hallway, but we are ready to go with the next one in Snow Miller. If that works.
Yes,
okay,
go ahead.
Okay.
Let's switch up a little bit. Paula, why don't you go ahead and tap into the other folks that have been waiting a long time, please?
On the list, okay.
Yes, on the list.
Julie Lee. Julie Lee, *6 to unmute if you're on the phone.
Yes, can you hear me?
Yes.
Okay, perfect. So after listening to this whole meeting, I find it rather concerning that you guys are going to even propose this resolution, and I'm a member of El Paso County. So I'm looking at the Colorado Revised Statute 18-3207, and it talks about criminal extortion, right? As threatening someone to get that person or another person to do or refrain from doing something against his or her will. So violation of that is like 2 to 6 years in prison, a $2,000 fine to $500,000. Even though you guys are doing this resolution, right? And you guys are sitting here saying, oh, we're agreeing to recommending the vaccine. What happens when it turns into a mandate? Who is going to be financially responsible, criminally responsible for violating human rights? Because this in itself is coercion. So we need to be careful of that. Like, I appreciate the fact that you guys are being proactive, but at the end of the day, this is not okay. In point 2, it talks about that the section by means of chemical, biological, or harmful radioactive agents, weapons, or poison. You're poisoning the people with a vaccine that has not been fully verified. Thank you for your time.
Thank you.
Patty Bilberry? Patty Bilberry? If you're on the phone, *6 to unmute. Naomi K, initial K.
I am here.
Please speak up. We can barely hear you.
Okay. See if I can. Can you hear?
No, get closer to the microphone or turn up the volume, please.
Can you hear me now?
Close enough, yes.
Okay. I guess I just want to say thank you first of all for everybody that has been here today on the line for 3 hours. We really appreciate you all listening to our comments and hearing what we have to say. My name is Naomi. I am a resident of El Paso County, and I'm in the healthcare industry. I don't have anything to say that hasn't already been said. I echo everybody's comments. What I would say is, if we're still thinking of passing, even voting on this resolution after hearing all of the issues with it, with incorrect data, not sufficient data on this resolution, then I would guess that your constituents would actually know where you lean if you're really looking out for their health or not. We want you to be asking the question of, why are people not being given other options? Why are people not being treated with early symptoms? Why are people being told that it's a free service when our taxpayer dollars are actually paying for this for-profit companies? Why is the NIH having a meeting December the 1st to discuss this controversial ethical and legal issues of mandating this? Why did Senator Ron Johnson just have a huge roundtable with people who are being unheard and ignored by the NIH and their vaccine injuries not being put in the system properly? If you guys are still thinking about voting on this after hearing all this, then we can tell that you're really not looking out for our health and safety.
That's right. Go, girl.
Thank you.
Next person, Jen. I just have a first name, Jen. If you're on the phone, it's *6 to unmute.
Is that Jen or Jay?
It's Jen.
Jen, it's probably me. Hi. I'm Jennifer Hudson. I'm a resident of El Paso County. I grew up here, and I'm here. There aren't a lot of new things for me to say. I will tell you I vehemently agree with what's been said before. I will tell you that we should absolutely stop this resolution. I don't even think tabling it is worthwhile. This is ridiculous. As Americans, we have the right to come up with our own solutions and moving forward. For you to mandate something in a blanket way that actually has an adverse effect on the number of people that it has had is ridiculous. Other vaccine tests and shots and things like that have had this much of an adverse reaction across the population have been stopped dead in their tracks. I believe it was the bird flu H1N1. Whenever they started trying to come up with the vaccination for that, they stopped it because it's adverse for 50 people. More than that have died with this, and this continues anyway. It's time to stop this. The mandate is not worthwhile. Please stop the resolution.
Thanks, Jen.
Cassia Barney? Cassia Barney?
This is Kasha. Can you hear me?
Sorry for the mispronunciation.
No problem. Can you hear me?
Yes, Kasha, go ahead.
My name is Kasha Barney. I'm an El Paso County resident. I just represent myself, I guess. But I just wanted to encourage faith in God over fear, even fear of man wanting this vaccine mandate or anything like that.
You go, girl.
So what we're doing here is going to impact our future generations. And even if it's different, even if there are different ways like supporting the immune system rather than supporting a vaccine, that will really impact our future generations. And I just wanted to thank you guys for serving on the board and for hearing our comments. And thank you for thinking about our future.
Thank you, Kasha.
The next person, just I have initial T. Initial T.
Yes, I'm here. Can you hear me?
Yes.
Go ahead.
Yeah, I'd just like to chime in with what sounds like the rest of the choir here from the public on just the absurd this meeting even being called to begin with. We're about something that's really not even a vaccine, that has not had sufficient time to be shown to be proven to be safe, to have the Board of Health concerned with trying to get shots into our arms instead of dealing with opiate epidemics and child alcoholism and preventative lifestyle choices is going to me. So I would ask the board to reevaluate how they approach health and how people can attain health. And that's all I've got.
Okay. Well, thank you. Thank you for your comments.
Next person is initial TK. TK.
Hi, can you hear me?
Yes.
Yeah, my name is Tom Kirk. I've been a resident for 21 years in El Paso County. My family's here, a number of children, a number of grandchildren, and a number are health professionals. I would hope that the board has been listening very carefully as many of them started off, and what they said was, this is not a mandate for vaccinations. If that's true, then why didn't that show up in the resolution? That should have been one of the first things. Should first start off saying we will never require mandatory vaccinations.
Okay, go ahead, continue.
You've completed your comments?
No, I'm sorry. It was, so I got put on mute there. Did you hear me from the beginning or not?
We did. Yes,
Okay,
but,
yes.
but go ahead.
Sorry for that. Not sure what happened there. Yeah, I would like to see if you do go forward with this resolution, which I don't believe you should. It should start off with, we will never require mandatory vaccinations. There should be also equal time or space in there talking about the treatments. I believe Speaker Dr. Brady talked about percentages. Thank you for that. That was much more meaningful to me rather than the raw numbers. The raw numbers didn't give me adequate information. The percentages helped a whole lot. I'd also like to give a shout out and thank you to the healthcare professionals. They're doing a wonderful job out there. They have been without the vaccine before, but now, unfortunately, a lot of them have been fired because they're not getting the vaccine. It is proving that these mandates do not work. We should welcome them back into the community, and even if they don't get the vaccine. Thank you. God bless America.
Well, thank you for your comment.
Next person, Angela Green. Angela Green.
Angela?
*6 to unmute if you're on the phone. Next person, Jay Inman.
Inman, there you go. Come on, Jay.
Good afternoon, everybody. And Dave Donaldson, shout out, howdy. I love the things that I'm hearing about you.
Physician Scott Youngblood spoke to the San Diego Board of Supervisors meeting on November the 2nd. That's on KUSI News, as they considered a similar motion for San Diego. He cited a CDC VIIRS report in which vast majority of deaths from the vaccine happens within 48 hours of injection. And that death rate is far higher than the normal COVID rate. Frankly, and this doctor was spot on, the conversation about the vaccination is one that should happen between a doctor and the individual patient, and then the individual chooses. This must not be a mandate or an increasingly untrustworthy government mandates these vaccines. And so my strong urging here is that y'all table this, take it off, remove it from the schedule, and you guys should prove to us that you are very trustworthy by letting us make our individual decisions in liberty.
Thank you. Yeah.
Next person, Nick Yaksix. My apologies, Yaksix.
That's okay. Can you hear me?
Yes.
Go ahead.
Okay. Thank you for choosing to hear comments before voting today. My name is Nick Yaksich, and I'm a resident of El Paso County. I'm also a pastor of the Jesus Church of Colorado Springs, and frankly, I'm shocked more pastors are not on this call or getting involved. The reason you're having such a response to this meeting is because of the long-standing pattern of this body mandating our lives, and anything that has a whiff of a mandate evokes a passionate response. The third bullet and other language in your resolution does leave room for affirming future mandates as it is currently written. The indignation of some of the board members that they have expressed that the people are being motivated by politics or are simply falling for misinformation is condescending. You have passed resolutions repeatedly for mandates before. Our suspicion of you, who have a track record of mandating our lives, businesses, and churches, does not reveal paranoia on our part, but rather the erosion of our trust. So please save the indignation and accept the fact that you have lost much of our trust and are responsible for rebuilding that trust. I'm not here to shake my fist at the vaccine. If you feel led to go get it, go get it. But if at any point in the future you think it is acceptable to force me, my wife, my kids, or my church family to get a vaccine, I want to make this very clear. We will not comply. Thank you for hearing our comments.
Thank you.
Okay, Dr. Turbush, that seems to complete all the hands that have been raised in the room. So I think we can go back to Snow Miller.
Okay.
For the next person at the podium.
Snow Miller?
I think we've got four here as well. So
Let's give them a chance to catch up. Snow Miller, please.
Thank you for your time. And my name is Annie. I am a resident of El Paso County. I bet you're hungry. We are too. And let's get going. I have over 20 years of pharmaceutical sales experience. I could not whisper the name of a drug without providing a product insert. I had to discuss the ingredients, the indications, the animal studies, the phase 1, 2, and 3 clinical studies, adverse reactions, special populations, pregnancy, and women who are breastfeeding. But when I go to the pharmacy to ask for a product insert for this so-called vaccine, I don't get one. I put some common sense together and realized that this makes no sense. In fact, it's bogus. The industry is dripping in evil, and it's dripping towards our government as well, asking us to do something that no one has a right to do. It is my body. It is my choice. El Paso County, be better. Do better. God is watching. Don't shed on me. Thank you. Have a good evening.
Thank you.
Hey, Dr. Turbush, this is Councilman Donaldson again.
Yes.
Hey, sir, it's about 5 o'clock now, 5 p.m.
Yeah.
You know, we've heard from lots of people, including, I think, 3 physicians, several nurses, and many, many others. I would like to, again...
Could you say it again, please?
I would like to, again, offer to make a motion to table this so that we can improve it. We can improve this resolution and bring it back at our next regularly scheduled meeting, not to surprise anyone, and kind of build some more consensus on this at that time.
Okay. Paula, how many are left to make public comment?
There are two more people actually in the
Oh.
room. With their
Okay,
hands
let's
raised.
address Council Members Donaldson's request after we've heard from the next two people.
Okay,
And Paula,
Jared?
We've got 3 in here as well.
Okay, can I revert back to the remaining 2 people in the room? I thought we didn't have, but we do have 2 more hands raised. So I'll call on those 2 and then go back into the room.
They waited a long time.
Starla Mercer, online.
Hi there, can you hear me?
Yes.
Yes, go ahead.
Yes, I am a resident of El Paso County. I'm in the healthcare field. I am a mother, and I just want to, first of all, acknowledge those of you who have initiated respecting our parent choice and our individual choice in this huge health decision. So thank you for that. We really do recognize who you are, and we recognize who the people are that are trying to push this through abruptly. As people that label themselves as working for the health department, I have not heard any of you speak to actual health. You're only speaking to vaccines, which do not promote health whatsoever. If you really care about our health, we should use some of the money that the government is funding you guys with to push through with these vaccines for therapeutics and things such as zinc, vitamin D, vitamin C, and education around getting sunlight and natural exercise. My kids are not responsible for elderly people that are incentivized with donuts and Big Macs and everything else like that to get their vaccines. So please put this on the shelf, and we do not support this resolution. Thank you guys for your time.
Thank you.
There's one more person in Teams, and then we can go back into Snow Miller. David Winnie. David Winnie.
Can you hear me okay?
Yes.
Yeah, go ahead.
Yes, I'm in full agreement with everything that every person has said prior to me. And I'm a 12-year resident of El Paso County, and I love living here. But I'm learning a lot about during this whole plandemic, scamdemic, scaredemic, how we are getting a lot of things shoved down our throats that have nothing to do with our constitutional rights of free choice. And it goes back to my body, my choice, what we're discussing right now. And this emergency resolution that you're wanting to pass is absolutely against the law and should not be even discussed like this without a long time of notice to the public to show up and discuss it with you in person, face to face, with a good notice of where that's going to be, because there was quite a mystery today when I found out about this, where this hearing was even going to be held. So I see some people have found you. So anyway, we need to not table this thing to stop it. It's against the law and has no room for service to the public.
Okay, thank you. Thank you.
Thank you.
Next.
Hi, my name is April. How many hundreds of people commented today, and not one single one spoke in support of this resolution. And that you need to take to heart. I think also that
there's many more people, hundreds of more people.
Yeah, exactly. Hundreds of people. And we need to also think about how you are reflecting on this when it comes to Jesus and what our bodies are. These are our bodies. It is our choice. And you need to think about that when you want to make this some kind of mandated thing. Our bodies, our choice. Okay? I think that you should confess your sins to the evil that you are putting in to making us do this. I don't want to get on a train like what they did years ago. That's what you're doing with this. That's not right. Okay? So I think that you guys should confess, and I think that you should accept Jesus into your lives and get rid of the evil that you're trying to promote here. Okay?
Thank you. Paula, how many more are waiting in line to make comment?
There are no more hands raised, but there are 5 people who have called in. So they would not have had the opportunity to raise their hands to make a comment. So I
Okay.
can call them out by maybe their first 3 digits of their exchange, if that would be helpful, just to make sure.
You know, folks have waited a long time to make a comment, so let's continue.
Okay, thank you. My name is Patricia, and I am an El Paso County resident. And respectfully, from your revised resolution today for your Board of Health, you guys said that you guys hereby find that the best measure is getting fully vaccinated. Shall we just ignore the ongoing lawsuits that are going on right now that finds this unconstitutional and unlawful? You guys say, trust the science. Why is there so much cognitive dissonance going on? What is going on surrounding this vaccine? If everybody who wanted to get the vaccine already has free money, they line up. Free food, they line up. Free vaccines, they kind of lined up. Everybody that wanted to get this vaccine already has. You're coming after the people who don't want to get it. We're standing on this resolution hill, but you're not going to hornswoggle us by the mandate mountain. We're not going to budge. We're not going to move on this. So please respectfully understand where we're coming from and took time out of our day today.
Thank you.
Next person is Snow Miller.
Good job, everybody.
Hello, I'm Anna Mitchell, resident of Colorado Springs. I do not support this resolution. El Paso County Public Health does not need a resolution. You need to do your job that you were appointed to do, which is to protect health. Making a resolution to promote a vaccine is not protecting health. You're deceived. Protect health. Do not try to use your resolution to sneak in a mandate, and we know that's what's coming. So just take it from all the citizens you've heard from and let it go.
Thank you.
Next person is Snow Miller.
Oh, that is all we have for Snow Miller. If you want to go to any of the phones.
Sure. The first exchange is 350, area code 501. If you're on the phone, you have to star 6 to unmute yourself. Okay. The next 3-digit exchange is 499, area code 719. Go ahead. Hello?
Figure out how to use it. They're probably talking. They can't.
Because I saw them come off mute. Well, I'll go to the next one. Area code 719, 3-digit exchange is 510. Star 6 to unmute.
What's going on?
Next phone number is 719. Exchange is 648. Star 6 to unmute. And the next phone number is area code 832. 3-digit exchange is 875. And I see you're already unmuted. Go ahead.
Hello, my name is Sally. I'm a resident of El Paso County. We've lived here for 2 years, and I just want to echo what everyone else has been saying, and that basically this comes down to freedom, and by mandating a vaccine, you're taking away our freedom of choice. And I think that y'all need to consider how many people have moved here And if this comes down to a vaccine, we came here for a job. If it comes down to a mandate, we will be gone. And I think y'all need to consider how many other people will be doing that. Thank you for your time.
Thank you.
And that is all.
Hello,
Oh.
can you hear me?
Go ahead.
Okay, some latecomers, I guess.
I could not unmute it previously. My name's Patty
Go-
Silberry.
Okay.
Go ahead, please.
Hi there, thank you. And wow, I had had a testimony well prepared and ready to give, but I have to say that I would only be echoing every other single person who gave their comments to this board today. It would be astonishing to see this board continue in the direction it was planning on taking today to pass this resolution. Hear this well, the residents of El Paso County do not want to be coerced to take a gene therapy that is untested and has shown not only to be ineffective at preventing the transmission of the virus, but has caused over 18,000 deaths. As of today, over 18,000 deaths and over 856,000 adverse reactions. In addition, I just want to say thank you to Councilman Gonzalez and Donaldson for speaking truth and advocating for the people today. To the rest of the board, how do you justify stating that only you have the evidence, authority, and the right to take a vote without hearing the voice of the people you represent? I would ask that instead you hear the voice of the people today. Thank you so much.
Okay. Anyone else that's
Yes.
been waiting to make a comment?
Yes, can you hear me?
Go ahead.
Yes, my name is Joel Lusby. I'm a resident of Monument, so El Paso County. I'd just like to register my desire to not make this vaccination a mandated rule in any shape or form. Thank you. That's all I have to say.
Okay. Thank you, Joel.
Mhm.
Anybody else? It's been waiting a long time. Go ahead.
I'm here. Can you hear me?
Yeah.
Okay. My name is Jessie Rosado Floyd. I'm also a resident of El Paso County and a mother. I've appreciated that, until this point, we have been able to live out this pandemic in not the same level of fear that a lot of our, fellow citizens in other parts of this U.S. have. So I just echo everybody's sentiments today. I see this resolution paving the way, and again, like somebody else commented, kind of being a gateway to a future mandate for our small businesses, for our restaurants. And yeah, I think that, to echo everybody's sentiments, we need to not be looking at pursuing further tonight. So my final thought is to Dave Donaldson, thank you for being a voice for all of the constituents. And I hope that you will go for governor.
Okay. Thank you. Anyone else? Anyone else?
Kim.
Okay, I have been, fellow board members, I'm looking here to see who's still on, but I've also been reading the chat, and I'll tell you, Paula, you have been grace under pressure, so thank you very much for moderating this and helping to give this opportunity for folks to give their opinion.
Dr. Donaldson, again, there are some hands up here on Teams. I don't know if you can see them on your screen or not, but different folks that want to speak, it looks like.
I believe that everybody with their hands still up.
Who's managing the teams? If you could go ahead and call on those hands that we still see up.
Dr. Turbush, this is Vicki. I'm taking over for Paula, and I believe that everybody with their hands still up on Teams has actually already gone. If I am wrong, if anybody's still waiting to comment, please speak up now.
Okay, well, let me run that out there one more time. If there's anybody else who wants to speak, please go ahead.
Yes, I would. My name is Ed Brady. I was late to the meeting, so I did try to raise my hand here. Resident of El Paso County, thank you for letting me comment. Although the resolution doesn't state that it will become a mandate, it just seems like this is the step to a mandate. And in the report, or and the documents to the VAERS database, I understand is even being restricted by medical institutions on having information posted to it. But I would like to see discussion from the El Paso County Board of Health about all the adverse effects coming in from the VAERS reports. I'm just a regular Joe. My wife is a nurse. We both have had COVID, and there's no consideration for those that have already had COVID. The number of people I've encountered lately who've had the vaccine and are getting COVID have been amazing. And I think the medical community has been leading us astray with vax or not. And those are the only two options, and bureaucrats as well. Thank you.
Thank you, Ed. Anyone else? Anyone on Teams? Okay. I think that's it. So we have had a real experience here today, board members, and I quite frankly am humbled and a little distressed that I so misjudged the feeling and really passion of the community members. And I don't know how many total we've heard from, but maybe we'll be able to figure that out. I've also been reading the chat, and there's a lot of information in there as well. So yeah, my opinion, I'm going to go ahead and call an audible again. I guess I get to do that every now and then. My opinion is that the resolution as written is not ready for prime time, that the changes to it have been, the recommendations have been multiple. And what I would do at this point is entertain a motion to go ahead and table this resolution. We can take it back and work on it and see if it could be made into a version that is palatable. And if not, then so be it. So I would entertain a motion at this point to table the resolution, to vote on the resolution, and
I will second it, I believe.
Another time. Okay.
I believe Director Donaldson has made the motion. I will second.
That's correct.
All right. Any other comments? This is the time. Other board members?
Dr. Turbush, this is Kari. So
Hi, Kari.
I'm not sure what we're tabling it for. Isn't this the time that we should talk about it as a board and talk about what the parts that we want to think about or take out or amend?
Please, yes, go ahead.
So you want me to talk about it?
Yeah.
All right. Well, from what some of the other board members have said, I certainly support putting voluntary in the title. I think I've heard from a lot of the comments that there's a lot of fear out there that this is going to be to a mandate, which is certainly not the purpose of it. The purpose of it, as I've stated before, is that we are the Board of Health. At this time in our history, this vaccination is the way that we know it's going to slow down / stop this pandemic. So that's the point of it. I mean, I don't know what else to say on that. I'm not sure what else. And I support taking out that second bullet point if that's a sticking point in the therefore part of it.
I don't even know why they bothered doing this.
Okay. Other board member comments about the resolution. There's a motion that's been made and seconded. This is an opportunity to make suggestions about the
They're not even
vaccine resolution. Go ahead.
Dr. Turbush, this is Dave Donaldson again. And yeah, I think there's a little more that we want to do with this than we're going to be able to accomplish tonight online. So I think a good path forward would be for us to maybe send recommendations to you, or have a meeting to specifically address what we want to have in this resolution, or find a way to do it. We're probably all a little tired, right? We've been on this now for what, 3.5 hours.
Yeah,
There are
I respect that, and excuse me for interrupting, but
Yes,
I
sir.
think there are other board members who would like to make comments at this point.
Absolutely.
There's been a motion and a second. I think this is an opportunity for other board members to go ahead and comment, and we'll bring this meeting to a close, I believe, pretty quickly. Go ahead, other
Yes,
board
sir.
members.
Colas.
Thanks, Ted. Go ahead.
First of all, I agree with you. Overwhelming response from the public. Unfortunately, I think a lot of them came to the meeting with the idea that we were going to mandate something, and that is very unfortunate. It costs them a bunch of their time, as to stay around that long when that was never our intention. Listening to all the comments, one of the things that I heard stated over and over again was individuals' ability to make their own choices. I have drafted another whereas bullet for the board's consideration, and I'll read it to you real quickly. It's whereas it is the responsibility of each individual and/or parent to consult with their physician and make an informed decision regarding their health care, to include the COVID-19 vaccine. I kind of agree with what Councilman Donaldson was just about to say, that their wordsmithing can take an awfully long time. And I want to respect everybody's time, but I will send this additional whereas statement that I think will help a lot of our public understand that we do support an individual's opportunity to speak to their own physician and make decisions that are in their best interest.
Do this.
Thank you. That sounds like a great idea. I think we ought to collect those individual suggestions, and at a later date, we'll work on it. We may have a work session or some other meetings, but you're right. It's too much for this evening. Other board member comments?
Commissioner
Yes.
Brimmer.
Cami, go ahead.
Thank you. I also, I'm in concurrence with Dave, and I think I had communicated a little bit of this thought before the meeting even started, that there was a lot of, while I was in agreement with the philosophy, we needed to ensure that it didn't communicate any indication of mandate, and pointed back to some things that we really knew we could stand on. So I liked one of the suggestions we heard from a very well-spoken constituent as well. He suggested 3 different whereases. I liked the second of the 2. I'll read that quickly, but I will also forward this on, as Ted is doing, and have it become part of what we work through. But I appreciated the statement, whereas public health respects all science and endeavors to make this resolution with humility. Public health encourages each citizen to evaluate their particular health situation with their physician in concert with the Health Human Services Vaccine Adverse Event Reporting System. So I think we're all, I think we're headed towards making sure that this is a comprehensive, fully reasonable and still data-driven, fact-based, arming our citizens with the information they need, and absolutely protecting their ability to make those decisions in this environment and in this situation. So I think there is a way for us to get there with a yes, and still stand on principles that are important to all of us. Including deferring to medical guidance. I think those are not in complete juxtaposition here. And sometimes they've been framed that way in the dialogue. I think this board, I believe that we can get there. I believe we can be very diligent with the proper wording in arming our citizens with great information, great education, not tying the hands of anyone. I think we can get there. So I'd like to see it tabled as well. I will share the verbiage that I don't remember. I think it might have been Barry Farah's.
I think he put it in the chat. Yes, Mr. Bennett. So I agree. Those three statements that he made are pretty good. Other Board of Health member comments. We're getting a lot of feedback.
There's some feedback.
A lot of feedback.
This is Commissioner Gonzalez. I appreciate all the information here. Dave Donaldson's comments and Cammie and Ted's comments as well. I did want to emphasize, because I saw a lot in the chat and then also on comments, this is somehow a first step. I guarantee you have members on this Board of Health and county commissioners who would absolutely come out against mandates. And so this slippery slope comment or belief that might still remain out there, I'm telling you, you have people who would not let that happen. Thank you.
And Dr. Turbish, this is Diana May. I've been just sitting quietly in the background. I do think you do have a motion and a second. In just me keeping track of parliamentary rules, that a motion that is on the table.
You might be muted, Dr. Turbish.
Yeah. You know, that happens all the time. Thank you, Diana. We do have a motion on the table from Councilmember Donaldson to table the motion. I believe there was a second. And let me put it out there for a vote to the Board of Health.
Alicia B., mascara looks great.
Okay. All right. Let's go around the room. Commissioner Gonzalez, are you in favor of tabling?
Sorry, got to unmute. Aye.
Okay. Commissioner Bremer.
Aye.
Councilmember Geek, are you here?
Aye.
Ted Collis? Thank you. Ted Collis?
Aye.
Okay. Councilmember Donaldson?
Aye.
Okay. Kari Kilroy?
Aye.
Doris Ralston? Doris, are you in favor of tabling the motion? We may have lost Doris.
She had
Dr.
said
Fu.
she had to leave early, remember?
Oh, did she? That's right. Dr. Vu?
Aye.
Okay, and I'm an aye as well. So of the remaining board members, we have more than a quorum. The motion is passed, and we'll table this resolution to some later date, TBD. And I just really want to thank board members again for hanging in there. I have changed my mind about public comment, and I think it was very valuable. I learned a lot, and just the intensity, the passion, and the various different viewpoints. That was educational for me. So I thank all the commenters this evening. Thank you, the board members, for hanging in there. And unless there's some other comment, I think we can close this meeting.
Dr. Turbish?
Yeah, can you hear me? This is John Heimsock.
We do. I think those guys are still there. That's John. He's one of them.
Yeah, can I speak now for just a minute?
Okay, go ahead.
Yeah, I'm glad you are tabling it. I'm going to suggest that you leave it tabled permanently and never bring it back up again. It is totally unnecessary and not even needed to have this resolution. And I certainly, being a Vietnam veteran, don't need to have a government official tell me what my health is and what I need to have done with it. And I already have freedom to speak with my doctor, and we can make our own decisions. I do not need any kind of resolution telling me that I need to have a vaccine mandate or any kind of vaccine for COVID-19 when it's really a genetic therapy agent. that has
Okay.
never really been tested, and more deaths have resulted
Thank
from
you.
that agent than anything else.
Thank
So
you.
I suggest that you table it permanently.
Okay. You know what? I think we were pretty thorough in trying to get all of the public comments in during the public comment section. We've moved on to a motion, a second, and we've taken a vote to table this motion. I think that's probably good enough. Diana May, do you have any other comments for me?
No, sir, I do think you, on the agenda, do have public comment on items not scheduled on the agenda. So not something that's on here. I know Commissioner Gonzalez is laughing, but I just show you doing. I don't know if anyone
Okay,
wants
well,
to
let's
comment.
do it
It's
right.
not on
It's a little bit like fighting the tide here, but let me go ahead and throw it out there again, is that we have put a motion to table. We've taken a vote. All the remaining Board of Health members have agreed to table the motion. Now, are there other topics other than a vaccine resolution?
Is now
Other
exiting.
topics that members of the public feel like they need to comment on this evening, please? Public comments about other topics. Okay. Not hearing any. I think we've completed the work of the Board of Health today.
Dr. Turbush, can I,
Yes.
sorry, this is Vicky. I just wanted to state something very briefly for the record.
Please.
The agenda for this meeting was posted on both the El Paso County Public Health and the El Paso County websites last Thursday, November 4th, which is in accordance to the Board of Health bylaws, section 1.3.
Okay, good. I'm glad you're keeping us legal and within the bylaws. So thank you for your comment on that.
Unknown
Any other
participant
comments
is
from
now
board members?
exiting.
Okay, well, let's end this meeting and we'll get back together at a later date. Thank you, everyone.